The curriculum designer for today's lessons, Dr. Ray A. Gapuz, MAN, DSc, and RN, USRN, Illinois and Georgia, HAAD RN, certified, Prometric, certified, CGFNS, certified, Summa Cum Laude, UST, and Board Top Notcher with a rating 89.20.
Good morning, Gapuz babies! And before we start this session, I'd like to greet everyone. Sumain nyo ang pagpasa at pagtatap ng board. Sagot naman lahat at sumain nyo rin. Go!
At sumain nyo rin.
Okay, so as I perfectly understand, this is going to be the first of a series. When I say this is the first of a series, towards the end of our presentation, you need to block our dates because there's gonna be some more of these online classes that are to be conducted for free for everyone. Okay, you just have to register ahead of time and make sure that you are participating on the date as specified. Okay, so I'm gonna announce which dates are we going to have our second, our third, our fourth, and so on. Okay, so this is just a first of the series. Okay, and I'd like you to participate because we're gonna upload a survey for the end of the class to ensure that we will address what you need. So in other words, kayo po ang magdidesisyon ano ang susunod na topic natin. So mag-upload kami ng survey at dun sa survey na yun, sabihin nyo sa amin anong gusto nyong topic, whether it's psych or med-surg or fundamentals, and then yun po ang schedule natin for our next session. Okay guys, let's begin. So let's talk about how to pass and top the board exam. Okay, shall we? Okay. So just because of our system, so far as of December 2019, we have produced 279 top notchers with 7 number 1 placers. Okay, so everybody say, I'm next. Sunod ka na yan. Okay, so ito yung aming record. 7 number 1 placers. Since 1994, 43 top notchers in one board exam. That's June 2003. And ang pinakamadami actually. 9 out of 10 placements December 2006 for a total of 279 top notchers in 1994. Everybody say, I'm next. And that includes a back-to-back from our student from UST Free Protagonist and our student from De La Salle, Melissa Malo. Okay. Okay. So everybody say, I'm next. For those who are aspiring to become top notchers, you are in the right virtual class. So, let me share with you now, ano naman yung sekreto ni Melissa? Paano siya naging number 1 sa board? Yung mga nag-a-aspire maging number 1. Thank you so much, sir. Thank you po to all our Gapuz staff and most especially to you. Your drills and classes really help, most especially in desensitizing me to the actual exam. Thank you po. Ako naman sabi ko, you are most welcome, Melissa. I'm so happy. I wasn't proven wrong when I discovered your potential and finally included you in the Top Notchers Mentoring. Kaya, you have an incentive package which will be awarded at our RN's party in a hotel. My congratulations to you and your parents. Sabi naman ni Melissa, I'm glad I didn't disappoint you po. And then I said, you proved me right all along, Iha, and I'm happy I did have you in the mentoring group. Sabi niya, thank you po for picking me. I said, you deserve it. Anong kwento ni Melissa? Hindi siya cum laude, hindi siya class valedictorian, pero nakita ko lagi siyang nasa harap ko during the review classes and she's taking down notes almost everything that I say. And then minsan binibiro ko nga siya ba yung secretary ng klase kasi kompleto yung notes niya. Then she sent me a research saying that you remember more of what you are learning, 50% more actually, if you write them down instead of just listening or typing it on your laptop. Tama naman yung research na yun. Okay? So, this time, okay, bago tayo mag-proceed, may mga waiting pa sa ating waiting room. So, approve na natin. Okay? Okay. Eto na tayo. The 3 essential focus for the NLE. Okay? Tatlo lang muna para hindi kayo ma-overwhelm. The 3 essential focus. Pero, meron tayong pang 4th na strategy. Okay? Ano yung pang 4th strategy na yon? Abangan nyo sa dulo ng ating virtual class. So, at this point in time, I'd like to highlight first the 3 things that you need to focus on to be able to pass or top the nurse licensure exam. Okay? So, importante lang, alam ninyo kung ano ang mga gagawin. Focus 1, what to expect in the board exam. Sabi nga nila, view the board exam as you're trying to go to war. And you don't go to war unprepared. You go to war with knowing what to expect. You expect that you will be bruised, you will be expect at certain points in time, you will be emotionally broken at certain points in time, you will be doubting yourself. That's normal because those are the pains of going through test taking. Kasi whoever said na yung nandoon ay alam mo na. Kasi what's the use of taking an exam kung alam mo na lahat, di ba? So expected natin yan na may mga bagay na alam natin, may mga bagay na hindi tayo familiar. Kaya nga, meron tayong tinatawag na strategies. Okay? So whoever would top the board is not necessarily the best student. You don't have to be summa cum laude, you don't have to be magna cum laude or cum laude. Sometimes those who top the board are those who are street smart. Okay? Meron nga akong tinatawag na chismis strategy. Okay? Lalo na ngayon na nauuso sa mga test items, yung tinatawag nating syndromic approach. When you don't see diagnosis of patients, what you see would be group of symptoms, and you have to know how to thread through those and navigate through those group of symptoms to arrive at a conclusion. Ano ba yung sakit ng pasyente? So, hindi na uso yung binibigay yung diagnosis ng patient. Uso ngayon, bibigay symptoms, tapos dapat ikaw alam mo kung ano yung sakit ng pasyente. So, 50% of the battle is won if you know what to expect in the board exam. Now, focus number 2. Okay? What is our focus for this part? Bago yan, i-approve ulit natin. Ang dami na namang naipon sa ating waiting room. Okay? Approve natin sila at baka mag-rally sila dun sa waiting room ng ating virtual class. Focus number 2, how to pass the board exam. Okay? Kasi ganito yung class. Alam ko, anxious kayo kasi nagpi-prepare. So, ang ginagawa natin ngayon with RA Gapuz, kung wala kayong good internet connection sa bahay, you can join our virtual class through our branches. Okay? Para yung internet, di mo na problema. Papasok ko lang doon to have the internet access para nakikita mo itong virtual class. And then we're gonna do face-to-face class when it's already permitted. Okay? So hopefully. Okay? So, yung focus number 1 natin, know what to expect. Ito yung focus number 2 natin, how to pass the board exam. Okay? Yung what to know to pass the board exam, you've done that. You did your nursing school. But the how of transforming what you've learned into your tool to answer questions with confidence and correctly, then that's something that we need to work on. Okay? So focus number 2, how to pass the board exam. Okay. So, ang unang-unang strategy kong ituturo sa inyo ay ang pinaka-basic. Ang tawag dito ay MAX. It's not the fried chicken being endorsed by Papa P. Coco M. Trick grade ko lang ha. Di ba may attempt ngayon na baguhin yung pangalan ng Ninoy Aquino International Airport? Balak na raw gawin na Pandaigdigang Paliparan ng Pilipinas. O di ba? Tagalog na Tagalog. Pero ano daw ang shortcut? Pandaigdig is pa, Paliparan is pa, Pilipinas is P. So magiging Papa P. O di ba? So, pag nasa eroplano ka, maririnig mo, tayo po ay bababa na sa Papa P. Welcome to the Philippines. Pwede naman, di ba? Okay, now, what's MAX? MAX is actually an acronym. Okay? Pag sinabi natin it's an acronym, okay, for what? Okay? It's an acronym for 4 strategies that you need to integrate to create one holistic tool in order for you to deconstruct a question. Okay? Approve muna natin yung mga nasa waiting room ulit. Ang dami nila. Kawawa naman. Okay. Let's move on. So the MAX set of principles used in deconstructing a question. So this pertains to Maslow's abnormalities, complications, and symptoms manifested by the client. So let's go over it. Maslow's hierarchy of needs. According to Maslow's, remember, the most basic need would be your physiologic needs, okay? And then, strategy number 2, look for abnormalities. So any patient with an abnormality is considered a priority over a patient who doesn't have an abnormality. 3, complications need to be checked initially. And take note that an acute complication is a priority over a chronic complication. What do I mean? So if a patient have, for example, surgery, the patient had BPH, and so the patient had transurethral resection of the prostate. So after prostatectomy, okay, which complication will you need to attend to first? Yung mga ganyan na priority. Would it be the fever or would it be the impotence? Now remember, acute complications is a higher priority than chronic complications, because in acute complications, the nurse can do something about it. Okay, so with fever, you can do your TSB. What about your patient with impotence? You can't do anything about it. Not even our hands or our tongue can do something about it. Okay, so yung ganyang strategy, tandaan. And number 4, analyze the symptoms manifested by the client. What do I mean by that? A symptom that is typical of the condition is not considered a priority because that's expected. For example, if a patient has Meniere's disease, ano daw ba yung Meniere's? Okay, that's a disturbance in the fluid balance in the inner ear. Okay, so therefore the patient will have vertigo. Okay, so what causes Meniere's? Sabi ng iba, advancing age daw, aging. Bakit? Meniere's. Advancing age. Okay, now take note. If the patient had Meniere's disease and the patient complains about vertigo, that is expected because vertigo is one of the tried symptoms of Meniere's. But if the patient had Meniere's disease and all of a sudden the patient had chest pain could be indicative of a complication that may or may not be related to the Meniere's disease. So you will have to prioritize that complication over a symptom that's expected. Okay? So let's move on. So let's try MAX as a strategy. Okay? So once again, let's approve those who are in the waiting room. Okay. So let's apply MAX strategy. The best way to learn about MAX strategy is actually to apply it to a sample question. Okay? So pag sinabi natin apply it to a sample question, here's a sample question. Which of the following clients, if admitted to the emergency department simultaneously, should be triaged as needing immediate attention? Okay. The key phrase there is needing immediate attention. So which means you have to prioritize because the patient needs immediate care. And when I say immediate care, the care must be done in less than 5 minutes. So level 1 yan sa ating priorities. Okay? So let's go through the option. A 22-year-old in labor with contraction 6 minutes apart. So that's an OB case. A 36-year-old complaining of chest discomfort and bluish spots over the sternum after a vehicular accident. That's an MS case. A 45-year-old wearing plastic wraps telling people that the end of the world is near. Okay, that's a psychosocial case or a psych case. And then a 5-year-old who is 3 days post-surgery has a temperature of 103 degrees Fahrenheit and purulent discharge. That's a pediatric case. Let's apply MAX strategy. First strategy is, sabi natin, Maslow's. So Maslow says physiologic needs first. Is there anything among the options that's not pertaining to physiologic needs? We have one, letter C. It's not physiologic, it's psychosocial, so we need to eliminate option C. Second, sabi ni Max, okay, A, abnormalities. Patients with abnormalities will not be a priority over those with abnormalities, without abnormalities. So in other words, ang priority mo ay yung may abnormality. Okay, over those na walang abnormality. Okay, so look at option A. Patient is undergoing labor, wala namang abnormality. So, we just have to eliminate it. We're left with 2. Sabi ng MAX strategy, letter C, prioritize patients with complications. Ang problema, yung option B, may complication. Ayan, no? Meron siyang bluish spots over the sternum after a vehicular accident. So, this could be indicative of embolism. Okay, and then look at letter D. Okay, so 3 days post-surgery. Okay, so what does that mean again? Okay, meron siyang temperature elevation. So may fever, may infection. So both sila merong complication. How do we break the tie? We move on to the 4th strategy, S. Okay, look at the signs and symptoms. Okay, if it is expected or unexpected. Take a look at option D. Okay, post-surgery, tapos may fever, tapos may purulent discharge. Would your fever and purulent discharge be expected in a patient with infection? Yes. So if that is expected, that's not a priority. Look at option B. Bluish spots, okay, could indicate embolism. Okay, is that expected in a patient with vehicular accident? No. Therefore, okay, we need to eliminate option D, and so the best answer is option B. What did we do? The process of elimination. Just make sure that when you do the process of elimination, you don't eliminate the correct answer. Okay? Okay, so the answer is B. Okay, so passing the test is sometimes just 99% a matter of having the right strategy. Okay? Okay, we have to use functional concepts. Sir, ano yung functional concepts? Functional concepts, it could be one word, one phrase, one sentence. Okay? That would enable us to answer 3 to 5 questions confidently and correctly. Now, functional concepts is actually a method that I created specifically for our review programs, and it's now being utilized in 25 countries worldwide. Okay? So, let's move on. Okay? So, let's pay particular attention now to the use of functional concepts. Bear with us. Alam ko may mga nagfa-fluctuate ang internet signal. So, just keep on entering our meeting room and we're gonna approve you right away. Okay? Okay. Alam mo naman, isa lang tong bansa natin. So magtiyaga na lang tayo. If that's a little sacrifice we could do to help each other out, let's do it. Okay? So how to use functional concepts. Paano gumamit ng functional concept? Let me give you an example. Okay. Example of a functional concept. Measles vaccine is an attenuated live virus vaccine. Actually, yung measles vaccine is created from eggs. That's why people with allergy to eggs, okay, which are very severe enough to cause respiratory depression, okay, may need to have the vaccine within a facility that will have professionals that are capable of addressing the allergic reaction. So in other words, okay, hindi mo pwedeng basta-basta ibigay ang measles vaccine nang hindi mo alam kung ang pasyente mo ay merong allergy o wala. So, kailangan, i-assess mo muna kung may allergy yung pasyente mo, di ba? Allergy ang tawag doon pag mayaman. Pag mahirap ang tawag doon, galis. Okay, so let's move on. Okay, how do we use this concept to answer a question? Here's a sample question. Before giving measles vaccine to a child, the nurse should ask the child's mother which of these questions, okay? So, ano daw ang itatanong mo sa nanay? Is your child attending a daycare school? Is there anyone in your family undergoing chemotherapy? Did you travel abroad during the past 6 months? Or did your child have colds recently? Okay, there's nothing that talks about allergy here. But what did we say? So ang measles kasi live attenuated virus vaccine. So it's created from eggs. So therefore, there's a potential that anyone who has poor immune system in the family, okay, could actually be triggered. So anong kailangan mo i-check? If there's an immunocompromised person in the family. So therefore, what will you ask them? Is there anyone in your family undergoing chemotherapy? That's the best answer. Kasi a person who's undergoing chemotherapy could be immunocompromised. Ganon din yung patient, okay, na meron siyang undergoing steroid treatment. Usually immunocompromised din yon. Okay? So here's another functional concept. Iodine-based contrast medium used in certain procedures may potentially trigger allergic reactions. Okay? So what does that tell us? So before a patient who's supposed to undergo a diagnostic procedure that would make use of contrast medium, we need to assess for, once again, allergy. Pag mayaman. Okay? Okay. So a patient is for intravenous pyrography. So do we use dye for a patient who's supposed to be undergoing IVP? Yes, it's a dye-based procedure. Before the procedure, which of the following assessment should the nurse make? Is it A, did you have a sore throat recently? B, do you feel dizzy in a head-down position? C, do you have any allergy to shellfish? Or D, can you remain still for a few minutes? Once again, we need to assess the patient for allergy. And so the best answer is letter C. Okay. So next, uterine contractions that are more than 100 seconds indicate prolonged contractions. Ayan. So usually, the normal contractions, okay, the duration of the contraction, the normal duration of contractions would depend on the phase of the labor. Kung latent ba yan, kung active or transitional phase. Okay? But, okay, for us to have a working figure, okay, usually, okay, 30 to 60 seconds is considered normal. Okay, now when the contraction goes beyond 100 seconds, okay, then the problem now is there could be uterine hypertonicity. Okay, so in other words, okay, we need to refer that to the physician. Okay, so our functional concept is uterine contractions that are more than 100 seconds indicate prolonged contractions. Okay, so let's proceed. Several women in labor were given Pitocin infusion. In which of the following situations would the nurse need to stop the infusion? Now, Pitocin is an oxytocic agent, so it is given to induce uterine contractions in patients having labor. So therefore, we need to check the patient's uterine contraction. So you need to monitor the patient's uterine contraction. What did we say a while back? 30 to 60 seconds would be normal. If it goes beyond 100 seconds, then that calls for the intervention of the physician, or we need to stop giving your oxytocic agents. Okay, here are the options. A, 32-year-old primipara with contractions of 70 seconds duration. So 70 seconds still, below 100, that's still perfectly fine. Okay, 35-year-old multipara with 5 contractions in the last 3 minutes. Nako, magmamath pa tayo. Eh, di ba kaya nga tayo nag-nursing kasi para lang isang math. Ito ngayon, simple mathematics. So, how many seconds do we have in 1 minute? 60. So, 3 minutes to. So, 60 times 3 minutes. So, that's 180. Okay, seconds. So, 5 contractions, use 180 seconds divided by 5. So, approximately 30 seconds. Okay, 30 to 35 seconds per contraction. So, normal pa. Diba? Sabi natin 30 to 60. Okay? Pinahirapan tayo ng option B. Pero ganun din ang option C. Look, a 37-year-old multipara with 3 contractions in the last 5 minutes. O binaligtad niya. So, 5 minutes times 60 seconds, that's 300. Okay? That's 300 seconds. Ilan ang contraction niya? 3. Okay, so 300 divided by 3. Ilan ang duration? 100 seconds. Is it already a danger for this patient? Yes, it is. So we can consider that as the answer. But let's still take a look at option 4. A 39-year-old primipara with 3 successive contractions that lasted more than 80 seconds, still below 100, that's still perfectly fine. So the answer is letter C. Sir, masakit sa ulo, malalim. Kumbaga ito, hindi lang abot hanggang throat, habot na hanggang esophagus ang lalim nito, papunta sa large intestines. Okay? So sobrang kalaliman. But if you are equipped with functional concepts, then you are able to deconstruct the question properly. Okay? I just hope you are learning. So next one. In anorexia nervosa, self-induced vomiting may occur after meals. Okay, this is actually an observation for those with anorexia nervosa. They usually go to their rooms or they go into a private place immediately after meals and they induce vomiting. Ito yung tinatawag na, okay, subtype ng anorexia. Okay? Ito yung tinatawag nating purging type of anorexia nervosa. Okay, now let's move on. Which of the following is an appropriate short-term goal of care for a patient with anorexia nervosa? Okay, look at this class. The key words here are short-term goal. Those are our keywords. Okay? Magkaiba kasi yung long-term goal. Long-term goal could be increasing the weight of the patient. Short-term goal could be what? What did we say a while back? A common behavior of those patients with anorexia nervosa, may umiyak na baby. Okay, purging type is that they induce vomiting after meals. They go to a private room or a private place. So if you place them in a public place, for example, a day room after meals, you prevent them from inducing vomiting. Therefore, the short-term goal could be, is it A, to increase food intake, B, to maintain normal body weight, C, to remain in a public place after meals, or D, to increase self-esteem? The best answer is actually C, to remain in a public place after meals. Okay? Okay, next functional concept. Maintenance treatment for a specific condition may indicate an underlying chronic illness that predisposes a patient to a complication. What does this mean? Some predisposing factors to illnesses could be, okay, masked in terms of being under a specific treatment. Okay, the best way to explain you this, the use of this functional concept, is to have an example. Here's an example. A 56-year-old male was admitted due to abdominal aortic aneurysm. Which of the following data in the patient's history is most likely associated to his present condition? Now, common risk factor to abdominal aortic aneurysm would be chronic hypertension. And that's what's being asked. Which of the following data in the patient's history is most likely associated? So the question is asking about a risk factor. Now, let's go over and analyze each. Sabi dito, social drinker. Social drinker is actually small amount of alcohol. Could be 1 to 2 small glasses of beer. Okay. On antihypertensive maintenance. Okay. Sounds positive. But if you analyze, if a patient is having a maintenance treatment for hypertension, this simply means that the patient is hypertensive. C, stands 5'7" and weighs 135 pounds, measures 36'24". The height and the weight are just actually normal. At 5 feet, you're expected to be around 100 to 110 pounds, and then you add 4 to 5 pounds for each inch after in the patient's height. So 7 times 5 pounds would be 35. So 135 pounds, the patient's within normal range. Okay. C, history of anemia during infancy. Well, those with iron deficiency anemia could actually be suffering from what we call a condition known as milk babies. Okay, milk babies are those who are chubby but pale because they lack iron, and it's because they are taking milk most of the time, and milk is a poor source of iron. Okay, so the best answer here, therefore, here is letter B. Once again, those patients, okay, with chronic hypertension are most likely suffering from, okay, most likely suffer from, okay, abdominal aortic. Okay, so therefore, we can say that your focus should therefore be about knowing how to answer questions. Dapat ang focus mo ay paano sumagot ng tanong. Kasi yung minimemorize natin ng mga facts, hindi lumalabas yan ng ganyan lang. Naka-format yan sa questions. Therefore, your class should be question-based. Yan. Okay. So, meron tayo dito, nakakatuwa. Ang subject, Miracle Book. This is an email from Emmy Marigomen. Sabi niya, Sir Ray, I finally made it. It's worth trying after 8 times of taking the exam. I finally found the answer to your miracle book. O, diba? Okay, most essential concept for the Philippine Nurse Licensure exam. This was the only book I've read 1 week before the scheduled board exam. Ang dami lumabas na similar questions sa book ninyo in the actual. Salamat po for the compliment. Bongga talaga. I remember in page 389, naglagay-lagay pa siya ng page. Okay, page 26, page 392, marami pang iba. Hahaha, sobrang bongga. Alam mo na kung saan galing yan. Sobrang bongga. You're such a blessing to everyone. Self-review was sulit with your Mosby book. O yung mga nagsi-self-review, attend kayo ng ating virtual classes which is going to be done for free regularly. So after nito, i-announce ko mamaya kung ano yung mga next dates natin. Okay? Okay. Sabi niya, when I saw your big billboard in Fuentes Mania, Cebu, I said to myself, I will buy that book for me to pass the exam. Your book is not only for local NLE, but also for foreign examination, pattern of questions as well, like the NCLEX. Okay? Problems are part of our life. Let us not forget that the shortest distance from a problem and its solution is the distance between our knees and the floor. And the one who kneels to the Lord can stand up anything. That is why I never gave up. It took me 8 times. Now finally God answered my prayers when I needed it most. One of the most prevalent diseases affecting mankind today is anxiety. Our excessive worrying shows the lack of faith in the ability of Heavenly Father to provide for our needs. Trust in the Lord forever. In the Lord is everlasting strength. Isaiah 26 verse 4. Worry is like a rocking chair. It gives you something to do, but it never takes you anywhere. Once you enroll, biglang may promo in our Gapuz. Make sure to buy his Mosby book for NLE so you will be worry-free. Have faith, believe, and pray. God is just a prayer away. Love you, Emmy MJ. Thank you naman, Emmy. Okay. Approve ko muna yung mga nasa waiting room. Okay. Okay. So let's move on. Okay, with our class. Mahaba-haba pa ito. So natapos na natin yung dalawang strategy. The first one is know what to expect. The second one, you have to know strategies how to pass the test. And third would be, let's try to answer sample questions. Okay, go. Okay. Here's an example. How is iron best taken? Eto nakakatuwa eh. Pag fina-flash ko tong question na to, students would usually say, how is iron best taken? Is it with meals, before meals, with orange juice, after meals? Tapos, okay, ang isasagot nila kaagad dito, okay, para daw to decrease GI irritation, take it with meals. but the question begins with how. So it simply means the process. So how is iron best taken? How? Then that's gonna be with orange juice. Okay. Iba naman ang sagot kung ito. When is iron best taken? Yan. Okay. It's usually best taken, para walang J irritation, after meals. But some literatures would say you could take it with meals. But the best method is really after meals. Okay? So, just a single word could change the correct answer. That's the point I'm trying to drive you at. Okay? So, sometimes passing the test is just a matter of understanding terminologies. Okay? So, now, let's learn how to deconstruct questions. Ayan na yung pangatlo nating strategy. Di ba sabi ko, we're gonna talk about 4 strategies, pero yung isang extra strategy would be towards the end of our class. Okay? Here's a sample question. Nitoy has been receiving chlorpromazine. Well, Foracin is an antipsychotic for 2 days. One morning, after breakfast, he rises from his chair and begins to sway, reaches out for the table and sits down. So, what comes to mind when you have this manifestation? This could be associated with orthostatic hypotension. And then the question goes, the immediate nursing intervention is it A, assess his pulse and respiration, not related to orthostatic hypotension? Continue to observe him from a distance? It could be, but it's not specific enough. C, assess Nito's blood pressure while he is sitting? It could be. D, instruct him to return to his room. The best answer is actually assess Nito's blood pressure because the patient is manifesting orthostatic hypotension. Okay. Now, how do you deal with different types of questions? Okay. The first step is you have to know the different parts of a question. So, the part of the question that gives you some specific data would be the stem. Okay. So you have the stem and then you have the options. Now the options are made up of the correct answer and the distractors. Now, in the board exam, we now have what we call your multiple choice with multiple response questions or the SATA questions, okay? We'll take that up in our future virtual classes, okay? So let's proceed. What are the things that you have to note in the stem? So what are the things that we need to note in the stem? Setting, okay? Setting. So in other words, ano ibig sabihin ng setting? Saan nangyayari? Saan nagaganap yung sitwasyon ng pasyente? Sir, bakit may effect ba yun? Oo naman. Why? Iba ang priority natin if we talk about disaster nursing. Iba ang priority in the area of disaster at iba din ang priority pag nasa ER na yung pasyente. So the context is very important. So yung mga phrases like, in the ER, underline mo kagad yun. Or during a disaster, underline mo kagad yun because those establishes the context or the setting of the question. Next, personal data. So, importante ba ang personal data? Oo, alam ko hindi nyo lang to pinapansin eh. Minsan pag nakita a 45-year-old, hindi nyo man ina-underline yung 45-year-old. Nakita nyo kanina sa lithium level. Iba ang normal pag elderly, okay, na nakikita natin sa salamin araw-araw. Mukhang elderly dahil sa lockdown. Or iba din ang normal lithium level for adult patients. So the personal data of the patient is very important and you have to take note of that. And then, of course, specific determiners. And they would ask me, sir, what are specific determiners? Ito nakakalimutan nyo. Ito yung tipong, alam mo, nasa tanong na yung sagot, tutuklawin ka na lang parang ahas, hindi ka pa nagpatuklaw. Okay, what are specific determiners? Words in the questions that could be just a rewording of the correct answer. So minsan, meron ng clue doon sa question, hindi mo pa nakita. Okay? And of course, number 4, okay, type of question. Always remember, a specific question requires a specific answer. A general question requires a general answer. And what's a general answer? It's the answer that has an umbrella effect. It encompasses all the other options that are given. I'll give you an example in a while. Okay? So here's an example of a question that we need to focus on the setting. Okay? The initial intervention when acid poisoning occurs at home. So nasa ng setting nito? At home. So, tatandaan mo, sa bahay, not unless ang bahay nyo ay pharmacy. Wala ka naman talagang syrup of ipecac dyan kasi napaka-ideal. So, at home ang setting. Okay? So, look at this. Administer a glass of milk. Okay? Induce vomiting. administer syrup of ipecac, or administer fluids per IV. O napaka-social naman ng bahay nyo kung may IV fluids kayo sa bahay, di ba? So, since ang setting ay home, eliminate na natin itong dalawa. Now, if you induce vomiting, now the acid would actually pass through the GI tract twice. Di ba? Nainom na nga niya, tapos in-induce mo vomiting. So, pumasok, lumabas, dumaan ng 2 beses, mas severe yung complication. Therefore, the intervention when this occurs is actually to neutralize the acid. And to neutralize the acid, you will have to administer a weak base. And to do that, yan, administer a milk. Yan, mga Ilocano, di ba? Gatas nga naggapo, New Zealand, di ba? Okay, go. Let's move on. Okay. Now, here's also a sample of a question in which we have to focus on the personal data of the patient. Look, a 70-year-old manic patient was admitted for serum lithium level monitoring. Look at this class, 70. What did we say a while back? When you have an elderly patient, the lithium level should not exceed 1.0. 1.0. Okay? So the therapeutic blood level of lithium is, yan, nako. Ito kailangan mo talagang pansinin yung edad ng pasyente at yan ay 70 years old. Okay, so is it 0.5 to 1.5? No, that's for adult, acute dose. Is it 0.5 to 1.5 milligrams per deciliter? The unit is incorrect. Okay, is it 0.4 to 0.8 milliequivalent per liter? We can consider, what did we say? It's supposed to be less than 1.0 for elderly. And 0.6 to 1.2 milliequivalent per liter. Again, it exceeded 1.2. This is actually the maintenance level. Okay, the therapeutic level for maintenance therapy for patients taking lithium. Now, when we have an elderly, the lithium level should not exceed 1.0. So the best answer is letter C. Yeah. So, importante pa lang tinitignan yung edad ng pasyente. Opo, kasing importante ng mga edad natin. Okay? But remember, age is just a number. I just hope you're learning class. Let's proceed some more. Nakaka-addict to eh. Specific determiners. Ano ibig sabihin ng specific determiners? Yan yung mga words na nasa question na kasing kahulugan ng isang word or iba pang words na nasa answer. So ibig sabihin nun, sir, may mga tanong na ang sagot ay nasa tanong na mismo. Correct ka dyan. So here's an example. Okay. Let me give you a sample question. Hospice is a recent development in nursing in the care of the terminally ill patients. In this situation, which type of setting is nursing care provided? Which word would you need to focus on? Hospice. That's the subject of the question. Tapos, biglang options, A, clinics, B, hospital, C, home, D, sanitaria. Hospice is actually synonymous with the word home. Kaya hospice care is actually home care. O, di ba? Nandoon na sa tanong, unang-unang word pa yung sagot dun sa question. Pag hindi mo nakuha yan, para kang tutuklawin ng ahas na lang, hindi ka pa nagpatuklaw. Kaya dapat, ang mantra natin, if you want to pass and top the board, magpatuklaw ka paminsan-minsan. Ganon. Okay. I just hope you're enjoying the session. I'm enjoying it with you guys. Okay? At wag natin kakalimutan towards the end, merong 5 mga masuswerteng attendees natin ngayon na makakakuha ng nursing reminder sheet. We're gonna send it. Oo. Darating sa inyo in January. Joke. Tapos na yung board exam. Hindi naman. Papadala natin agad-agad kayo naman. No? Tapos, yung mga nag-attend ngayon, lahat kayo makakakuha ng PDF file nito for free. Okay? Now, let's do an act of kindness. Huwag naman natin parusahan yung mga hindi naka-attend. Malay nyo naman, di ba? May mga rason sila. Okay? Kanina nag-uuna ng computer tapos nag-brown out sa kanila o nag-uuna ng computer tapos mali ang naisaksak na kuryente. Yung ganun. Okay, so bigyan na rin natin sila ng kopya. Okay, you can share it. Let's do an act of kindness. During this pandemic time, let's be kind. First to ourselves. Okay? Ayan, sige ang mga pumapasok. Pasok, ayan.
Okay.
Hatag. Oo, hatag. Naririnig ko kayo. Next one. Ang cute natin. Type of question. What did I say a while back? A general question requires a general answer. Diba? A specific question requires a specific answer. So what is a prerequisite essential skill that you have to know for you to be able to apply this strategy properly? Kailangan marunong kang mag-classify. Ang unang titignan mo, anong type ng question ba ito? General ba o specific? Ganon. Okay, tingnan natin. During a pandemic, nako, saktong-sakto to. Which of the following is an effective information dissemination strategy to reach target groups? Bongga. Okay? O bago ko makalimutan ha, bago tayo mag-proceed. Okay? You don't have to focus more on writing para hindi kayo nadidistract. Okay? Kasi may handout kayo. And then those of you may want to watch this, i-upload namin to and then we'll send you the link. Okay? Para kung gusto nyo balik-balikan to for the rest of your life. Okay lang. Pag gusto nyo matutunan yung paulit-ulit na nanaginip ka, sige, on mo. Okay? Meron. Bibigyan namin sa inyo ng libre. Huwag kayong mag-alala. Everybody has to be kind at this point in time. Wala kaming pinagdadamot. Okay? So, focus lang kayo dito para natututunan nyo yung hindi nyo matututunan pagka pinapanood nyo na to at saka pagka nag-aaral na kayo on your own. Okay? So, huwag ka muna magsulat. Makinig ka lang muna. Okay? Kasi kung magsusulat, meron ka namang kopya nito after. Okay? So, let's move on. Radio. O di ba ang sinasabi niya is ineffective. So hindi siya specific. Hindi naman niya sinabing is the most effective. O di ba? Kung most effective kasi hindi ka nangangailangan ng internet signal, pwedeng radio kasi 99% of the household sa bansa meron 'yan. Oo, 'yun ang sinasabi, di ba? Pag ang question is most effective. Kaso hindi eh. Ang sinabi lang niya ineffective information strategy. So therefore, this is a general question. Hindi mo din pwede isagot ang newspaper. May nagbabasa pa ba niyan ngayon? Okay. Hindi mo rin pwedeng isagot na social media, madaming fake news. So what could be the correct answer? Look, traditional and digital mass media. So you're using two. Traditional, then you use mass media. So when you say traditional and mass media, does it include social media? Yes. Okay. Newspapers? Yes. Radio? Yes. Traditional and digital mass media. So option D encompasses what is contained in options A, B, and C. Therefore, this is what we call the umbrella answer. The answer that encompasses all the other options. So a general question requires a general answer. Okay? Yan. Pero pag binago yung tanong, ang dinagay dyan, this is the most effective information dissemination strategy. Radio yon. Kasi hindi pwede social media, marami pang walang internet dito sa ating bansa. Okay? Let's move on. Go, go, go. Things to note in the options. O pag tinitignan mo naman yung mga options, ano titignan mo? Similarities as well as differences. Tatanda mo to strategy na to. Sometimes the correct answer could be one of two almost similar statements. Pag may dalawang pagpipilian na halos magkapareho na, para naliligaw sa'yo, halos magkapareho kasi kambal. Isa doon ang tama. Okay? Next, danger words. Yung mga danger words. Usually, yung mga words na may all, always, never, none, usually those statements are incorrect. Pero may exception. Okay? There's always an exception to the rule. Of course, kung ang nakalagay dun sa option is always maintain a patent airway. Of course, that is correct. Kahit na may word na always. Okay? Huwag mong sasabihin na, sabi ni Sir Ray, basta may word na always, incorrect. Nakalagay doon, always maintain a patent airway. Priority yun, no? Okay? So, it's always correct. Pag nilagay mo doon na always maintain a patent airway, even if it contains the word always, that statement is correct. Okay? And then keywords. Okay? Mga initially, specifically, in general, those are keywords that you need to focus on. And then the type of option. Once again, a general question requires a general answer. A specific question requires a specific answer. So when you have a general question, look for a general option. When you have a specific question, you have to look for a specific option. Yan. Okay. Now, let's have an example. Masaya to. Tapos mamaya, itong mga natutunan natin na to ay ititest natin. Okay? Okay. Glaucoma is caused by, it's asking about pathophysiology. Okay. A, blockage of the outflow of the aqueous humor by the dilatation of the pupil. Blockage of the outflow of aqueous humor by the constriction of the pupil. One of two opposite. Baka nandyan yung tamang sagot, sir. Kasi sabi ng isa dilatation, sabi ng isa constriction. But remember, class, it's asking about the cause. Is glaucoma mainly due to the blockage of the outflow of the aqueous humor? Or is it related to something else? Let's go over the other options. Take a look at option C. Increase intraocular pressure resulting to optic nerve damage. Ayan na siya. Diba? And then, decrease intraocular pressure resulting to decreased production of aqueous humor. So, letter D is the opposite of the first two options. Letter D is the opposite of option C. Okay? So ito increase, ito decrease. Now remember, The main problem in glaucoma is actually your increased intraocular pressure that results to damage to the optic nerve. That's why this could lead to progressive decreased vision that leads to blindness that could be irreversible. Okay. Now, patients with acute glaucoma could have an intraocular pressure about 50. Okay. Okay. Now, those with the IOP of 25 and above but less than 50 could be suffering from chronic glaucoma. Okay, those who have IOP that's less than 20 could have normal IOP. Okay, okay. Just remember facts and then apply. So the best answer therefore is letter C. Note, A and B are opposite. Sabi ni isa dilatation, ito constriction. C and D opposite din. Sabi ni isa increase, sabi nito decrease. So, ganyan sa board. Medyo, paano pag dalawa yung opposite, pero parehong opposite yung apat? Naku, windang. Okay? That's where your theoretical knowledge should come in. Okay? Now, here's an example of a question with danger words. Okay, look at this question here. All of the following statements about aging is false except. Okay? Except. So, you are supposed to be looking for something that's true. Okay, old people are always slow moving. The word always is a danger word. Any sentence that contains the word always, you need to focus on it because sometimes, more often than not, it's a false statement. Okay, next, we need to focus on something. Okay, all old people suffer from osteoporosis. Again, you have the word all. Okay, so which simply means it could be incorrect. Okay, next. Elderly people are not able to learn new tasks. The key word not. So it indicates something negative. Okay, it could be also false. Okay, and letter D, suicide among the elderly is usually, it's not telling you that it would always, it's just telling that's usually successful. Yes, researchers have shown that 1 out of 2 elderly patients who plan to commit suicide eventually, okay, would be successful in killing themselves. So, who are most at risk to suicide? It's actually the elderly. So, the best answer here, which is not false, meaning which is true, is letter D. Suicide among the elderly is usually successful. Okay? Okay, let me just accept one more. Okay, mga latecomers. Okay. Now, here's an example of a question that contains keywords, okay? Yuri, 18 years old, out of school youth, was caught shoplifting in a department store. He had a history of being quarrelsome and involved in physical fights with his friends. This is a key phrase, being quarrelsome. So the social interaction is in question, okay? He has been in and out of jail for the past 2 years, so the patient habitually breaks the law. This is already a habit, in and out of jail, which simply means we're looking at a person with antisocial personality disorder. Okay. Initially, the nurse identifies one of the following nursing diagnoses. Okay. Initially. So it's telling us that all of these nursing diagnoses could be appropriate for the patient, but we have to identify and understand that initially, okay, you have to come up with one only. Okay, so which one? Altered thought process, well, that could be associated with patients with schizophrenia, which is primarily a thought disturbance. Impaired social interaction, it is very related to the main topic of the STEM in the question. And sensory perceptual alteration could be used for patients having hallucinations. And self-esteem disturbance could be associated with patients who are unable to perform activities of daily living. In this case, you have a quarrelsome patient. And so the best initial nursing diagnosis would be impaired social interaction. Now remember, the phases of the nursing process are all covered in the exam. So you have to focus on assessment, okay? And we have a lot of good videos in our YouTube channel, Gapuz Mentors. Okay, please do visit that. We have a lot of good videos. Those are applicable also for both the NLE and the NCLEX, but we'll soon be uploading pointers video also. Okay, and our video uploads for this presentation would be through that channel. Okay, okay. Now, if the board exam is given today, are you ready? Okay. Now I will call on Prof. Jem Karaig to facilitate the administration of the test. Prof. Jem, tell them the mechanics. we will give you 25 minutes to answer the questions. After that, we're going to explain. Okay, I just hope you already have downloaded. Okay, if you haven't downloaded the questionnaires from your emails, it has been sent yesterday and today. Okay, may mga pinadala ngayong umaga, yung mga late na nag-enroll, saka yung kahapon. Okay, please do download them now. Or kung ayaw mong i-download, okay, have a piece of paper, have a pen, number it from 1 to 25, and then come up with an answer. Here's Prof. Jem, who will facilitate this portion. Pasok, Prof. Jem.
Hi, good morning, everyone. Okay, so for today, okay, we're gonna answer the 25 questions. No, you need to answer first. Okay, the 25 questions for 25 minutes. Okay, so we'll place a timer now. Okay, and I do hope everyone will answer it so we can identify. Okay, we'll start the timer now.
Okay, colleagues, time is up, and now we are ready to present and discuss with you. The answers to the questions on the test. And then, after this is done, there's gonna be a twist dito sa gagawin natin. Alam ko matutuwa kayo. Okay, ikatutuwa ng mga nandito. May mga lumabas sa chatroom natin, siguro nagtitipid sila ng kanilang data. So, pakisabihan na sa Facebook kung naka-on sila sa Facebook Messenger, okay, or sa WhatsApp, na nag-umpisa na tayo mag-rationalize and they can come in again. We are really sorry for the low internet signal, okay, being suffered from by some of our colleagues. So we just pray na makahanap sila ng paraan to engage in our classes better. So here's Prof. Jem Karaig to do the discussions for the first 10 questions. Okay, Prof. Jem, pasok!
Hello. Okay, good morning again. Okay, so I hope everyone is happy to hear and listen to every lectures that we have. No, so let's discuss one by one. Okay, the questions that we have for the first 10. Okay, we have number 1. Okay, situation: the nurse is preparing to provide care to patients with infectious conditions. So number 1. Okay, so this is very current. Okay, which of the following statements is considered fake news about COVID-19? Okay, so it's actually part of a good question, no? Okay, since we know the fact that every time we open social media platforms, we see different types of news. Okay, so let's go one by one. Okay, 1. It originated from bats and not bioengineered as a biological weapon. Okay, number 2, fresh sperm that is ingested does not help eradicate the virus in the GI tract. Okay, number 3, intake of anti-inflammatory agents like ibuprofen may worsen the respiratory symptoms. Okay, and number 4, transmission is primarily prevented by the use of face masks. Okay, so if we are going to consider to answer it one by one, number 1, it originated from bats and not bioengineered as biological weapons. So first thing to remember, is the answer. Okay, so the answer is transmission is primarily prevented by the use of face masks. But let's do it one by one by knowing why not 1, why not 2, why not 3. Okay, could be the possible answer. So according to CDC, coronavirus is usually spread through droplets. Okay, and transmission is best prevented through a combinations of frequent hand hygiene, social distancing, and the use of a surgical face mask. So what do we have to remember? Okay, what do we have to remember? In number 4, okay, for the first question, transmission is primarily prevented by the use of face masks. So face mask alone is not enough to prevent the spread of coronavirus. It requires us, okay, to have a frequent hand hygiene, okay, social distancing, and the use of a surgical, okay, mask. So, are we clear? Okay, good. So, another thing, okay, that we need to remember, okay, for, okay, the COVID-19, no, for COVID-19, remember, if you are positive with COVID-19, if you are positive with COVID-19, you need, okay, self-isolation. Okay, so let me just okay give some pointers okay to this. Okay. So when we consider now okay COVID-19, ayan, o di ba? Oh, pwede magsulat. Okay, so COVID-19. Okay, positive. Okay, so COVID-19 positive client, so considered to be ill. Okay, so you need self okay isolation. Yeah. Okay, self-isolation. So when we say self-isolation, it requires us to stay at home okay for okay 14 days. Okay, for 14 days, no? Okay, but if you are exposed, okay, possible you okay have contact to a patient with COVID-19, okay, so you consider naman okay having okay self-quarantine. Okay, so it's actually a different okay term, no? So if you are ill, okay, with possible COVID-19, you need self-isolation. But if you're exposed, okay, to COVID-19, okay, you need self-quarantine, okay, for 14 days. The question is, okay, lahat ba ng nagpa-positive sa COVID-19 kailangan ng medical treatment? Okay, yun lagi natin tinatanong, no? Kasi may mga concerns tayo, okay, as individuals who are positive to COVID-19. Kasi dati, pag ikaw yung nilalagnat, nanay mo lang yung concern sa'yo. Okay, ngayon, pag ikaw may lagnat, buong barangay gusto kang dalhin sa ospital. Kasi baka magkalat ka, ganun. Okay, but what do we have to remember, no? Okay, na hindi lahat na nagpa-positive or may symptoms ng COVID-19 will always require immediate medical care. So, it is very important to take note, okay, that 80% okay, na may positive COVID-19 nagre-recover. Okay, nagre-recover okay, kahit walang hospitalizations and okay, treatments. Okay, so what do we have to remember? Okay, so pag sinabi natin COVID-19, no? Okay, we consider clients who are high risk. And we expect, no? Okay, from the news that we are actually okay hearing, older people okay are most at risk to okay COVID-19, and older people with hypertension, yan, hoy, yung mga may heart disease, yan, hypertension, okay, heart disease, okay, diabetes, okay, and even cancer, okay, patients are most at risk, okay, to have COVID-19. Okay, now the question is, how would you know if you are suffering from COVID-19 even without confirmatory swab test, no? Okay, feeling mo meron kang COVID-19 with the presenting signs and symptoms. So, when we assess our clients or kahit ikaw na lang mismo, pakiramdaman mo since we are on a pandemic state, ibig sabihin, everyone can be infected okay, with the COVID-19. So, paano malalaman? So, common symptoms na meron kang COVID-19. Okay, fever. Ayan, no? Kaya pala dapat lagi tayong ini-scan. Okay, pag mga pupasok tayo ng mga public establishments, no? Okay, then we have dry cough. Okay, ngayon nakakatakot. Okay, ang pag-ubo. Okay, no? Umubo ka lang ngayon, lahat na ng tao lalayo sa'yo. Okay? And, okay, tiredness. Yan. Okay, so we have, okay, fever, okay, dry cough, and, okay, tiredness. So these are the three no most common symptoms of COVID-19. Okay, but there are some questions na baka lumabas. Okay, yung mga less common type. Okay, less common symptoms na pwede natin makita. So, nagkaroon ka ng headache. Okay, nagkaroon ka ng nasal congestion. Yan. Okay, conjunctivitis. Yan. Okay, sore throat. Okay, and even loss of taste. Yeah. Okay, so we have your headache, nasal congestion, conjunctivitis, sore throat, and even loss of taste. Okay, kasama rin dyan ang diarrhea, and rash. Yeah. Okay, clear? Clear. Okay, so the question is, pag ganito ba ang symptoms natin, kailangan ba agad i-hospitalized? Okay, of course, not, no? Okay, so, sinasabi sa atin, if you are positive or probably suffering with the signs and symptoms related to COVID-19, you may start doing self-isolations, or if you get exposed, you may start having self-quarantine for 14 days. Okay, for 14 days. No? So what are the severe symptoms? Severe symptoms na mas kailangan ng medical care. Okay, so ito na yung, pag tinamaan ka, feeling mo meron ka na nito, it's most important that you need to seek medical care and hospitalization will be required. So what are common severe, symptoms? You have difficulty of breathing, nahirapan ka ng huminga. Okay, we also have chest pain. Okay, chest pain. Okay, chest pain. And also, the loss of speech. Yan. Okay, loss of speech. So these three symptoms would be considered severe that it requires immediate medical care. Okay, immediate medical care. Okay, the question is, what if kung may fever ka, fever lang, so basically, ang sabi natin, fever, dry cough, tiredness, less common signs, hindi kailangan ng hospitalization unless it becomes severe. Okay, pag may fever ka, and then, with outbreak, yan. Okay, outbreak of malaria, yan. And, and even dengue. Okay? So for example, may fever ka, tapos may outbreak ng malaria, outbreak of malaria and dengue, kailangan mo bang magpa-consult? Yes. Okay, kailangan mo magpa-consult. Okay, pero kung fever lang, then dry cough, tiredness with less common symptoms, no need. Okay, no need for consultations, no? Okay, pero kunyari nga may fever ka and then may outbreak na malaria and dengue sa area nyo, then you need to consider having a consultations. But commonly, again, pag mga may sintomas ka lang, even without the swab test, the best way is to always practice the protocol being provided to always stay at home, self-isolate or self-quarantine, monitor the signs and symptoms, and would you always tell no social distancing, 1 meter distance at least, and always use a face mask. Okay, clear? Okay, so that's for number 1. No? I just give some pointers to remember. So again, for COVID-19 positive, self-isolation for 14 days. If you're exposed, self-quarantine for 14 days as well. Okay, high risk, older people with hypertension, heart diseases, diabetes, and cancer. So if you feel having fever, dry cough, and tiredness, these are what we call your most common, most common signs, no? Or, what we expect na hindi kailangan naman totally na ma-hospital or kailangan ng medical treatment. Okay, and then less common, we have headache, nasal congestion, conjunctivitis, sore throat, loss of taste, diarrhea, and rash. Okay, and for severe that you need to be in the hospital to be treated, immediately we have severe difficulty of breathing, chest pain, and loss of speech. Okay, and fever with outbreak, malaria, and dengue. Okay, should be considered to seek immediate medical care. Kung may fever ka, tapos may outbreak ng malaria, okay, and dengue sa area nyo. Okay, next. Okay, so let's go back to number 2 question. So the first question is letter number 4. Okay, the first question answers number 4. Transmission is primarily prevented by the use. In the term primarily, again, it is not only the face mask that can prevent. Okay, it should be face mask, okay, frequent hand hygiene, and social distancing. Okay, number 2. Okay, in the hospital, okay, which of the following interventions is appropriate for the nurse to implement when admitting a patient diagnosed with Legionnaire's disease? So the question is asking about the different types of isolation precaution. Is it airborne precautions, droplet precautions, contact precautions, or standard precautions? So let's try to find out the answer first, no? Okay, the answer for this is standard precaution. Okay, the answer for this is standard precaution. So what do we have to remember? Okay, pag standard precaution. So let's give some informations about this, no? Ayan. Okay, so what do we have to remember? Okay, that Legionnaire's disease is a severe form of pneumonia caused by Legionella, a bacterium that requires standard precaution. So repeats, Legionnaire's disease, a severe form of pneumonia caused by Legionella, a bacterium, requires standard precaution. Okay, so to give some pointers about Legionnaire's disease, don't forget this. Okay, that Legionnaire's disease is transmitted via drinking water. Okay, so drinking water, not by exposure to an infected person. So what does it mean? That in Legionnaire's disease, there's no human-to-human transmission. Okay, repeats, in Legionnaire's disease, there's no human-to-human transmission. You can only have the Legionnaire's disease if you have drank, if you are drinking a contaminated water. So usually, Legionella bacteria is actually found in fresh water. Okay, fresh water. Okay, so don't forget, no? Okay, that's for Legionnaires. Okay, so no special precautions are necessary, for Legionnaire's disease. Okay, the CDC, however, recommends implementations of standard precautions. So it means we need to protect ourselves, when we are caring for patients, and always consider, how does it actually being transmitted, to human. So again, no to human transmission, but you can have this if you drink a contaminated water. Okay? Clear. So the answer for number 2 is, letter number 4. So don't forget this, no? Standard precautions are implemented for the following conditions. So aside from Legionnaires, what are other conditions, that might be placed, under standard precaution? So we have TADAN, B, R, A, and C. So remember that brats, as our mnemonics, no? So to remember this, brats rather, we have B, botulism. So botulism is actually placed also in standard precaution. We also have rabies. Rabies. We also have AIDS. AIDS. We have amoebiasis. Amoebiasis, and even anthrax. Anthrax. For T, we have toxoplasmosis. Toxoplasmosis. We also have toxic shock syndrome. Toxic shock syndrome. And we have shigellosis. Shigellosis. So don't forget, that even salmonella, salmonella is actually placed under standard precaution. So to repeat, we have standard precautions are implemented for the following conditions. So we have botulism, rabies, AIDS, amoebiasis, anthrax, toxoplasmosis, toxic shock syndrome, shigellosis, and salmonella. Okay, so since the question is also asking about the Legionnaires, so let me just give some pointers. Okay, for Legionnaires. Okay, don't forget it. No, so we have your Legionnaires. Okay. Okay, Legionnaires. Okay, disease. Yan, no? So when we see Legionnaires disease, again, no to human, to human transmission. Okay, then contaminated water. So commonly, the onset is 2 to 10 days. Okay, 2 to 10 days, after exposure. So it's very important to always remember for Legionnaires. Plus, when we assess, our clients. So commonly, since this is pneumonia, so there's a presence of cough, then shortness of breath. Okay, shortness of breath is also present. No, so we have cough, shortness of breath. Okay, we also have syempre, this is infection, so you expect that there's a presence of fever. Okay, muscle pain. Yan. Okay, muscle pain. Okay, muscle pain and headache. Yan. So commonly, no? Okay, so what do we have to remember since the common transmission is related to drinking contaminated water? So prevention is better than cure. Okay, so always consider having good, maintenance of water system. O, di ba? So dapat, no? Yung pinanggagalingan ng tubig para hindi magkaroon ng contaminations, will be, maintained properly. So when we consider now the treatment, since this is a problem related to bacterial infection, so consider the use of antibiotics like fluoroquinolones. Yan. Another one, pwede rin gumamit ng mga azithromycin. Yan. Or doxy. Doxycycline. Yan. Since we have to remember that there's no vaccine for Legionnaire's disease. Okay? So, ma'am, paano ba yung tina-assess? Or ina-identify? So diagnostic tests, usually they use the urine, antigen tests. And syempre, kailangan din ng support with the sputum culture. Yan. So urine antigen test and even sputum culture. Clear? Clear. So of course, clients who are considered to be high risk. So sino po yung high risk? Syempre, yung medyo mababang immune system like elderly clients. Another one, yung may history of smoking and lung disease. So prone sila for bacterial pneumonia. So what we always consider is Legionnaires. Again, Legionnaires can be prevented and can be treated properly. So again, for number 2, the answer is standard precautions. Standard precautions. Clear? Clear. Very good. Ayan, thank you. Wala na tayong tilaok ng manok. Siguro, natinola na kasi anong oras na eh. Ganon. Prof. Jem. Ano number na tayo? Number 3 na. Prof. Jem. So, which of the following patient is not properly isolated? 1. Rina, 2 years old with measles on airborne precautions. Wait, that is actually correct, no? 2. Nina, 5-year-old, with bacterial meningitis on droplet precaution. That is also correct. Tina, 7-year-old with viral meningitis on contact precautions. And number 4, Lina, 9 years old with rabies on standard precautions. Tapos ang tanong mo, si Rina, Nina, Tina, Lina, magkakapatid ba? Charot. Kasi, what do you have to remember for this? So, not properly isolated is si Tina. Why? Viral meningitis on contact precaution. So, let's give some pointers about this type of isolation precaution. Don't forget that for viral or fungal meningitis, it has a different precautions when we compare to bacterial or meningococcal or meningitis. Okay, so when we say viral or fungal, tadan, you place the client in standard precaution. While bacterial or meningococcal meningitis, okay, droplets. Okay, droplet precaution. So when we say droplet precaution, it requires a private room, no? When giving care to the patient, you have to always protect yourself from having infection. So don't forget it. So pag viral and fungal meningitis, standard. Bacterial or meningococcal meningitis, droplets. Okay. Are we good? Okay, very good. Okay, next. Number 4. Okay, number 4 na tayo. Grabe. Okay, in a patient with acute infectious polyneuritis, which of the following occurs initially? 1, descending paralysis. 2, ascending paralysis. 3, mixed type paralysis. 4, generalized paralysis. Actually, no, okay, there's a keyword okay, that you need to remember. Acute infectious polyneuritis. And another keyword is initially. So what is acute infectious polyneuritis? Okay, so the answer for this is it's actually the same as your Guillain-Barré syndrome. Okay, Guillain-Barré syndrome. So in Guillain-Barré syndrome, you know that there is inflammations of the peripheral nerves. Therefore, okay, the paralysis starts from the what? Feet. Okay, so lower extremities. Okay, so what do we have to remember now? The paralysis goes, okay, the paralysis starts from the feet and then okay, it goes upward. So, anong sagot natin? Ascending paralysis, pataas. Okay, pataas. So what do we have to okay, remember? Okay, that infectious polyneuritis is characterized by inflammation of the myelin sheath, okay, of peripheral nerves characterized by progressive muscle weakness. So to repeat, okay, infectious polyneuritis is characterized by inflammation of the myelin sheath, okay, of peripheral nerves characterized by progressive muscle weakness. Okay, progressive muscle weakness. Again, okay, when we say okay, acute infectious polyneuritis, or commonly known as Guillain-Barré. So the usual okay, weakness starts from the lower extremities. Okay, so the first symptoms of infectious polyneuritis is tingling sensations of the labia. No, okay, it is tingling sensations in the toes, okay, feet, and legs. Okay, so again, from the lower extremities, tingling sensations in the toes, okay, feet, and legs. Okay, feet and legs. Okay, so to give some pointers, no, with that. Okay, so when we expect for questions like okay, this, okay, you have to always remember to consider some of the treatment. So usually, pag mga sinasabi natin acute polyneuritis that causes weakness, paralysis of the legs, later on, it will become severe once it will paralyze the respiration. So habang tumatagal, pag lalong lumalala, mas nakakatakot kasi yung respiratory muscle pwede ma-paralyze and the patient will not be able to breathe. Okay, clear? Clear. And when we talk about acute infectious polyneuritis, no? Okay, the specific cause is unknown, but it can be related to infections related to history of respiratory infections, gastrointestinal infections, and from the research also currently, we have found out that Zika virus can also be a risk factor or a possible causative agent that may trigger acute infectious polyneuritis. So for number 4, the answer is number 2, ascending paralysis. Okay, number 5. Nako, 5 na tayo. Okay, in every patient with acute infectious polyneuritis, which of the following test is indicated? Okay, which of the following test is indicated? So the confirmatory for this is actually number, okay, okay, what number? It should be okay, lumbar puncture or spinal tap. Okay, lumbar puncture or spinal tap. Usually, what we okay, see in lumbar puncture is the presence of high protein but fewer WBC. So, mataas ang protein pero mababa ang WBC. Okay, or kakaunti yung WBC. Okay, for this type of problem. Okay. So next, okay, so lumbar puncture is indicated in every suspected case of infectious polyneuritis. So that is correct. Okay, but to support, not only that, no, to support, okay, the diagnostic procedure, okay, related to acute infectious polyneuritis, we also consider having, okay, EMG. Okay, EMG means, okay, electromyography. In electromyography, we identify, parts of the body with possible weakness, of the muscles. Okay, that's our electromyography. And we also conduct nerve conduction studies. Okay, so nerve conduction studies to identify also, okay, the muscles, okay, who might be weak due to infectious polyneuritis. Okay, so the answer for number 5 is number 3, lumbar puncture, or commonly we know that as spinal tap. Okay, no? So next, another one. Okay, situation 2. Wow. Okay, I hope everyone, okay, maganda ang score dun sa first 5 questions, no? Okay, so sana naka 5 out of 5. Okay, kung 4 out of 5, okay pa rin. Kung 3 out of 5, okay pa rin. Kung 2 out of 5, okay pa rin. Kung 1 out of 5, okay pa rin. Again, it's okay. Okay, kasi nag-start ka pa lang naman. Okay, and as a beginner, okay, minsan hindi pa talaga siya ganun kaganda, pero at least you have tried your best. Okay, next, we have situation 2. Ito na. In the medical ward, the nurse is interacting with a cardiologist about the procedures that a patient will undergo. Ayan, may nagsusulat, may lumalabas sa sulat. Okay, undergo and manifest of coronary artery disease. It's okay. Okay, so in the medical ward, the nurse is interacting with the cardiologist about the procedure that the patient will undergo and manifestations of coronary artery disease. Okay, question. Which of the following waves are normally found on the ECG? Okay, select all that apply. Okay, no? So this is one of the most, okay, challenging, okay, topics that we need to remember for the actual test. Since we are preparing to become a competent nurse, okay, so we need to consider, okay, knowing about this. So we have tall peak T wave. It's not normal to be seen, no? There is T wave, but it should not be tall peak. Tall peak suggests abnormality, and usually it relates to hyperkalemia. A high potassium level would lead to tall peak T wave. Okay, number 2, U wave. Yes. Okay, we all know the fact that, okay, PQRST are normally seen, but there's also a U wave, which suggests repolarizations. Okay, but when you see the term pathologic U wave, and that's basically pathological, it means it's abnormal. Okay, so this one, U wave lang, it's still normal part of ECG. P wave, yes. Okay, double peak R wave, no. So when we say double peak R wave, it's related to coronary artery disease, like those clients with bundle branch blocks. Okay, QRS wave, yes, that's still normal. Okay, and F wave, no. That is considered to be abnormal. So to find out, the different, okay, the different depolarizations and repolarizations of the ECG. So let us, okay, try to find out this figure. So normally, as we know, we have the PQRST, but in a deeper sense, okay, of knowing what is actually present on the ECG, okay, so don't forget this. P stands for atrial depolarization. Okay, P stands for atrial depolarizations. Okay, QRS, okay, represents your ventricular depolarizations. So repeats, QRS represents ventricular depolarizations. Okay, how about T wave? Okay, ventricular repolarizations. Ventricular repolarizations. Ma'am, you did tell us, Ma'am Jem, that there is also a presence of U wave. Yes, that is normal. So to figure it out, okay, aside from pre-QRST, which we commonly know, okay, another figure, okay, we have the J point. Ayan. Okay, the J point is when you see before the T, okay, will have its, okay, no? Okay, inflection. Well, okay, this is now your U wave. The repolarizations of the Purkinje fibers. Okay, so that normally occurs. Okay, that normally occurs, okay, during repolarizations of the ventricle. Okay, clear? Or repolarizations of the Purkinje fibers. So basically, we know the fact that we have your PQRST, okay, with J point and U wave. So these are all normal. Okay, so U wave is thought to represent the repolarization of the Purkinje fibers. Okay, so that's considered to be normal. Okay, next. Another one. Okay, we have, tadan, the normal U wave. Oh, diba? Okay. So akala natin pag U wave, it's always pathologic. No, it's not. Okay, we have to remember that there's also a normal U wave. So it comes after the T wave. It may not always be observed due to its small size and has an amplitude of less than 1/3. Okay, 1/3 of the T wave amplitude. Okay, so clear? Okay, about this. Okay, next. Okay, 7. Hala. Okay, 7 na tayo. Which of the following waves on the ECG indicate myocardial infarction? Okay, myocardial infarction. No? So the term infarction okay, means that there's already damage to the heart muscle. And that is being represented by the ST segment elevation. Okay, ST segment elevation. So the question that comes into your mind, what is myocardial infarction, right? Okay, so when we say myocardial infarction, so basically, okay, we know, okay, that this is a problem related to, okay, obstruction. So when we say MI, okay, MI occurs, okay, when, okay, blood flow, okay, decreases, okay, or stops, okay, decrease, okay, or stops, okay, to the heart, okay, to the heart, okay, and, okay, leads to, okay, damage, okay, nagkaroon na ng, oh, ganito na lang, okay, that stops to the heart and, okay, causes heart damage, yan na lang. So, paikliin natin. Okay, so nagkaroon na ng heart damage, okay, doon sa kanyang heart, okay, muscles. Okay, so that's what we basically, okay, know about, okay, this. Okay, so what we consider, okay, since this is MI, no? Okay, so decreased blood flow, okay, to the heart. So the representations of ST segment elevation. So what are common abnormalities? Okay, when we talk about ECG, okay, so we have, tadan, irregular QRS with indiscernible P waves. Okay, it means you are suffering from atrial fibrillation. So when we say irregular QRS with indiscernible P waves, we cannot identify the patterns of P, which is normally present. Pag nawawala ang P waves at nagiging irregular ang rhythm, and that's basically atrial fibrillation, bumibilis ang tibok ng puso. So commonly, we know this as sinus tachycardia. No? Okay, next, chaotic waves. Okay? Nagwawala, chaotic, no? So it's related to ventricular fibrillation. So pag nagkakaroon ng chaotic waves, delikado. Because ventricular fibrillation is the most dangerous, okay, arrhythmia. And it could mean that the patient will suffer from cardiac arrest. Another one, tall peak T wave. As I have said a while back, pag sabing tall peak, okay, it's abnormal. It's related to hyperkalemia. Hyperkalemia. Okay, next, okay, ST segment elevation. ST segment elevation. Ayan na. Na-confirm ang sagot natin. That's myocardial infarction. That's myocardial infarction. So ST segment elevation would mean that there's already a damage to the heart muscle. Tadan! O, di ba? Natututo ba? Okay, twisting of QRS complexes. Okay, twisting of URS. Naku, ito na, no? Okay, in a simple reading, pag binasa natin is torsades de pointes. Ganyan tayo magbasa, no? Pag gusto lang natin maalala. Okay, but we pronounce it as torsa de pois. Ay, ganun, ang sosyal. Okay. Parang pag galit ka dun sa kaibigan mo, torsa de pois. Ganon. Okay, parang gusto mo sabihin ganun pag dinitindihan, ay nako, sana all. Mataas ang IQ, di ba? Ganon. Okay, so P wave buried in the preceding T wave. Ay, ano ibig sabihin nun? Okay, the patient might be suffering from SVT, no? Or what we know as your supraventricular tachycardia. Okay, supraventricular tachycardia. Okay, and so these are the wave abnormalities, and its associated diagnosis. Ayan na, nako, number 8 na, kinakabahan, baka wala pang tama, magsasampu na, ganon. Okay, so number 8, which of the following is the priority goal of care for patient with myocardial infarction? So remember, as I have given you the definitions, it occurs when the blood flow decreases or stops to the heart, causing damage to the heart muscle. So it means our priority is to increase, ayun, no? The coronary blood flow. Okay, so dapat magkaroon uli ng good circulations papunta sa puso. So, to give informations and knowledge about this, don't forget, the treatment goals for a patients with MI, include, ayan na, number 1, to improve the coronary blood flow, di ba sabi natin? So the first thing is, we initially administer the antiplatelets. And commonly we use the aspirin while out of hospital. Okay? So nakalagay dyan, no? Initially, aspirin. So, to emphasize, ang pinakauna pala, the first drug to be given to the patients who suffered from MI should be aspirin. Ma'am, can it be combined with another antithrombus kahit na may possibility of bleeding if the cause is clot? Yes. Because ang priority at this time is to remove that clot and to prevent further damage to the heart to improve the coronary blood flow. So basically, pwede i-combine with another antithrombus such as your heparin or a fibrinolytics, no? Yung mga fibrinolytics natin, yun yung mga may mga ACE sa dulo, no? Streptokinase, 'di ba? TPA as soon as available, no? Currently, pa nagbibigay tayo ng mga mga antithrombus, mga antiplatelet, pag mga emergency settings, we try to give it within 4 hours. Dapat mabigay na natin kasi pwedeng tumigas agad yung thrombus after 4 hours. No? So, mas mabilis, much better, no? Number 2, ayun, to decrease myocardial oxygen consumption. So, kailangan mo ng mga vasodilators. Okay, so ano yung mga vasodilators natin to decrease myocardial oxygen consumption? So, you have your beta blockers. Ayan, yung mga LOL family, like atenolol, yan, no? Metoprolol, chuchu. Okay, and ACE inhibitors, yan. Okay, mga pril, no? Okay, captopril. Okay, so that's the second part of our management. And the third is to manage the pain. Okay, so we usually administer narcotic, such as your morphine. So to repeat, the treatment goals for patients with MI includes to dissolve the thrombus with the use of your antiplatelet, antithrombus, and your fibrinolytics. Number 2, to decrease myocardial oxygen consumption through the use of your beta blockers or ACE inhibitors. And number 3, to manage pain. Okay, with the use of your narcotic or what you know is your morphine. Okay? Iyan, naku, ang dami natututunan. Ang sarap po umati ng webinar, di ba? Okay, number 9 na tayo. Which of the following drugs should be administered first? Ayan, we just discussed this, no? First, for patients with suspected MI who is being transported to the hospital through an ambulance. Don't forget, nasa ambulansya na. So if you are actually inside the ambulance, treatments are being given immediately. So again, the first, or the priority is to increase coronary blood flow. Okay, so the answer is Okay, aspirin. Okay? So aspirin. So let's give, okay, some pointers about this topic. Okay? So patients with suspected MI should be given aspirin. Okay? In the ambulance or emergency room. Okay? So another one, okay, ma'am, bakit sa libro nakalagay oxygen, no? Okay, previously, when we consider the first intervention to be given, we always answer oxygen. Okay, but currently, okay, kung mababa ang kanyang oxygen level, okay, or may signs of respiratory distress, pwede ka magbigay, okay, ng oxygen agad-agad. Yun ang recommendations currently, no? Basta mababa yung oxygen level, okay, and may signs of RDS, pwede ka mag-oxygen. But since wala namang ibinigay sa informations or questions that the patient might be suffering from low levels of oxygen or signs of RDS, then we could definitely answer the oxygen now. So the best is to always improve the coronary blood flow by giving the aspirin. Oh, 'di ba? Ganon. Okay, ito na yung favorite mo. Okay, select all that apply. Yung dapat saktong-sakto ang sagot mo. Bawal ang kulang, bawal ang sobra. Enough. Ay, ganon. Parang pagmamahal. Bawal ang sobra, bawal ang kulang. Dapat enough lang. Okay, para fit na fit. Ganon. Number 10, a client with chest pain that has lasted for more than an hour has been admitted. Okay, upon evaluations of the patient's medications history, the nurse notes polypharmacy. Which of the following drugs could have worsened? Okay, could have worsened the patient's condition. So, with this type of problem, this can be related to MI again, no? So, we did discuss that morphine can be given. So, hindi yan ang sagot. Furosemide. Yes. Okay, no? Ma'am, paano naman po nakaka-worsen ng furosemide? No? Furosemide is commonly known as your Lasix, pampaihi. So pag nagpaihi ka na nagpaihi, ang tendency na babawasan yung iyong fluid sa katawan. And that can lead to what? That can precipitate decreased cardiac output. Okay, so pwedeng magkaroon ng heart failure ang pasyenteng may MI kapag nasobrahan ng labas ng tubig sa katawan. Okay, so hindi pwede bigay si furosemide. Okay? How about levothyroxine, no? Okay, so yes, it can precipitate other problems related to MI. Bakit? Man, ang levothyroxine ginagamit natin yan sa mga mababa ang thyroid functions or those clients with hypothyroidism. Okay? It means ang side effect niya is pataasin, okay, yung functions ng iyong sympathetic, no? Pwedeng tumaas ang functions ng kanyang puso. Ibig sabihin, gagalaw or kikilos or magfa-function ng heart sa pasyenteng may MI, delikado kasi it might precipitate later on with a stroke. Ang kailangan natin pag ang pasyente may MI, medyo napapahinga yung puso Okay, with the use of levothyroxine, it could trigger possibilities of complications related to MI. Aspirin, nako, yan ang pinaka-importanting drug. The first drug that we always have to consider initially to be given. So, no. Amitriptyline, yes. Okay, why? Di ba, amitriptyline is a form of antidepressant, tricyclic antidepressant. No, ang side effect ng mga amitriptyline nakakapagpataas ng heartbeat. So it can actually increase your heartbeat. So it means matitrigger mo na naman yung heart na mag-function. As much as possible kahit paano dapat nagpapahinga. Okay, para magkaroon ng good blood circulations at hindi mabawasan yung oxygen. Okay, na nagfo-flow dun sa heart. Okay, streptokinase, no. Okay, again, it's a form of treatment to a patient with MI. So to repeat, okay, so some drugs that may potentially worsen existing cardiac problems include, the TCAs, your amitriptyline, okay, levothyroxine, okay, and your furosemide. Should not be given to a client with myocardial infarctions. Oy, first 10 questions yun na. Okay. So, okay, I hope everyone is doing well. Okay, at nag-e-enjoy at natututo. Yun naman ang purpose natin ngayon Okay, na sa kabila ng daming nangyayari, dapat tayo ay positive at naniniwalang papasa. Diba? Okay, that's for my portion, no? Okay. So, thank you once again for the 10 items. Good luck. Okay. Balik ko na kay Sir Ray. Okay.
Okay, I just hope you enjoyed your time with Prof. Jem Karaig, and definitely we'd like everybody represented. Kaya nandiyan si Prof. Jem. Okay. Now, let me welcome one of our junior lecturers, our most competent drill master. Ladies and gentlemen, okay, my pride, of course, lahat naman sila ng mga mentors ng RA Gapuz, kahit yung mga mentors na naka-deploy worldwide in our branches in 25 countries worldwide. Wow, sayat naman. Are all trained by our system, and I'm proud to share with you the opportunity now with one of our mga juniors. Ayan. Ladies and gentlemen, here's Miss Michelle. Okay, go tayo, Mentor Michelle.
Ayan. Hi, friends! Kamusta kayo? Nakakain na ba? Pwede naman kayo kumain during class. So, benefit ng online classes. Okay, so sino ba dito yung nakapag-aral na for board exam? Yan, magkakaiba naman kasi tayo ng style sa pag-study. So, sino dito nakapag-aral na? Taas lang ng kamay. Okay, so iba talaga hindi pa nakakapag-review. That's okay. So, kapag nagtuturo ako, usually talaga, inuumpisan ko, tinatanong ko yung student, ano ba yung una mong subject na inaaral? Kasi ang sinasabi nila usually is med-surg, di ba? Yung mga diseases. Ayan. So, personally speaking, ako kasi nung time ko, nag-start ako with psych. Yan. Kasi for new takers natin, first-time takers, meron tayong 5 parts sa exam. Ang tawag ay nursing practice. So, 1/5 of that exam ay psych. Compared mo kasi sa med-surg, ang dami kasing topics nun. Tapos distributed lang siya sa 5 NPs natin. So, tip lang yon sa akin, gumana siya. Inuna ko is yung psychiatric nursing. Kasi for sure, 1/5 ng exam mo is psych. Okay, so let's proceed. So, naiwanan lang. Diuretics are usually prohibited in patients with acute right ventricular myocardial infarction. Okay, so situation number 3. In the information age, the presence of digital tools that has made research a faster process while at the same time presenting some ethical issues. Ayan, so marami ba ditong may gusto ng research? For sure, hindi. Kasi for me, medyo boring siya na subject. Pero, ang tandaan ninyo is sa board exam, napakaraming research questions and ethical questions. In such a way na bawat part, bawat NP, meron kang makikitang question about research or ethics. So, maganda na i-focus nyo rin siya. Okay, number 11, which of the following ethical principles is used by the nurse as a basis when deciding to use the thinnest and shortest needle that would cause the slightest discomfort in a patient who is about to receive an injection? Ano sagot niyo dito? Diba sabi ni Sir Ray kanina, meron talaga sa board exam na nandun na yung sagot sa mismong question or pwede ring may clue doon sa mismong question. So ano yung clue natin dito? Yung slightest discomfort. Okay, so sa patient care kasi, hindi mo maiiwasan talaga na may some sort of injury ka na may inflict sa patient, pero as long as it benefits the patient. Okay, so ano ba ibig sabihin nun? For example, kailangan ng IV line ng patient mo. So tuturukan mo siya, di ba? So meron ka pa rin some sort of injury na makukos sa patient mo. Pero dapat your actions should be working towards minimizing the risk of harm to the patient. So kapag gusto mo na do no harm or do minimal harm, that is your, yes, non-maleficence. Yan yung sagot natin. So let's discuss ethical principles. Okay, first is veracity, that is truthfulness. So kapag may tinanong sa yung pasyente mo, you are ethically bound na magsabi ng totoo sa pasyente. Okay, next is autonomy. Autonomy is your freedom of choice or the patient's freedom of choice, self-determination, and privacy. So dito natin nakikita yung application of consent before procedures. Next is beneficence. From the word itself, benefit. You want to do good towards your patient. So that is the duty to promote well-being of others. So dito pumapasok yung mga health promotion activities natin. Number 4, non-maleficence. Again, it's do no harm. So anong palatandaan natin? Kapag mayroong binanggit na procedure, mayroong binanggit na devices na gagamitin sa patient mo, it is usually non-maleficence. Because kapag meron kang maling nagawa sa procedure, it can cause, di ba parang harm to your patient. Masasaktan yung pasyente mo. So kapag may nabanggit na device or may nabanggit na procedure, it's usually non-maleficence. Okay, and then justice, that is fairness. So, ang application natin dito is usually sa mga resources, in terms of resources. For example, nasa emergency ward ka, and you have 2 patients. Yung isang patient mo is slightly elevated blood pressure, pero other assessment findings are normal. Yung isang pasyente is decreased level of consciousness. So, sino bang uunahin mo doon? Siyempre, di ba, ang unahin mo is decreased level of consciousness na. So, that is being fair to your patients. That is the application of justice. And then, meron tayong nabanggit na paternalism. Okay, what is paternalism? It is still under beneficence. Pero that is doing good to your patient without having to consult your patient. Kasi under paternalism, meron tayong belief na yung education, yung knowledge ng healthcare professionals mo gives them the authority to make decisions. Okay, so yung application nun, for example, psychiatric ward, yan, psych patient siya. So altered cognition siya, ayaw niya na magpa-wound care. Pero alam mo na ikasasaba niya kapag hindi siya nagpa-wound care. So doon nag-apply yung paternalism. You know better than the patient. Okay. Number 12, which of the following describes ethical dilemma? Anong sagot niya dito? That is number 3. Okay, receiving a request from the patient's family not to tell the patient about his laboratory result. Kasi pwede yung maging in conflict sa veracity mo or truth-telling. Pwede rin yung maging in conflict sa autonomy mo. Paano gagawa ng informed decision-making ang patient if hindi niya alam lahat ng information about his condition, di ba? Okay, so bakit hindi kasama yung discharging a patient against medical advice? Okay, so ito yung tinatawag nating DAMA or HAMA, pinapapirma yung pasyente kung ayaw talaga niya magpa-admit. So that is discharge against medical advice or home against medical advice. So ino-honor mo pa rin yung autonomy ng patient mo na ayaw niya magpa-admit. Okay? Number 2 is following a DNR provision in the patient's will. What does DNR mean? That is do not resuscitate. So, nasa option na mismo siya. Mayroong living will yung patient mo and ino-honor mo yung kanyang autonomy. Number 4, listening. Siguro dito na lito yung iba, listening to the opinions of family members on whether the patient's respirator will be discontinued or not. Mali ba yung makinig? Di ba meron tayo sa psychiatric nursing na tinatawag na active listening? And active listening conveys acceptance, not necessarily agreement. Magkaiba yun na, baka mamaya nalilito kayo. It means na ina-accept mo yung opinion ng family and ng patient, pero not necessarily agreeing with them. Okay, so number 3 ang sagot natin.
Wala din pa kasi sinabi niya.
Number 13, when a research study focused on determining the cause and effect relationship between 2 variables, the study is considered to be, ano sagot natin dito? Experimental. Diba from high school days pa, kailan ba natin dinedetermine yung cause effect? Kapag experimental study siya. Because experimental research is done to test causal relationships or relationships in which one variable causes another. Ayan, so i-discuss na lang din natin, descriptive. Yan, kapag research kasi, ang lawak niya na topic. So, minsan nalilito ka na or ang dami mong kailangang aralin. So, mag-derive ka from the word itself. Descriptive siya, meaning this study wants to describe something. So, ang example natin dito is survey. Diba? Kunyari, gusto mo i-describe yung population. Gaano karami ba ang buntis? Gaano karami ba ang graduate ng college? Yan. So, yun yung descriptive study. And then when you say infoveillance, that is using online data to or for surveillance purposes. Anong example natin dyan? So medyo bago lang siya kasi medyo recent lang din naman yung technology na available na sa lahat. So example is gusto mong malaman kung ano ba yung most concern or ano yung marami sa tao na concern nila during COVID. So, pwedeng i-survey mo, titignan mo yung mga, ano ba tungkol yung mga tweets nila tungkol COVID. So at least in that way, maaaral mo kung ano ba yung pinaka-concerns ng mga tao. Okay, next is explanatory. From the name itself, you want to explain something that is usually a problem or a phenomenon. So from the name itself ka lagi magde-derive. Okay, number 14. Vulnerable subjects in research include the following except. Ayan, so sa board exam, ito tatandaan, syempre time pressured ka, kinakabahan ka, kasi feeling mo hindi mo, kulang pa rin yung naaral mo. Kahit gaano karami yung pag-aaral mo, laging parang feeling mo may kulang. So, kinakabahan ka niyan. Ang nangyayari and tendency ng students is, okay, alam nila tama yung line of thinking, but then, hindi nila nabasa na except. So, ang dami, sayang yung point na yun. So, kapag magbabasa ka ng question, ayan, tandaan nyo to, pag magbabasa ka ng question, nakita mo may except, may not, bilugan nyo na agad yan. Para kapag babalikan ninyo or nagsasagot na kayo, alam na ninyo, okay, ito pala yung hinahanap, yung except. Okay? So, sino dito ang except vulnerable subjects natin? That is nasa options na mismo, consenting adults. Meaning, nag-consent sila na mag-participate sa research mismo. Okay, what are vulnerable subjects? They are those who are prone to coercion, like children, too young and too old. Diba nga kaya sa mga newly grads natin or sa mga syempre meron tayong thesis lahat, ganyan. Diba ang thesis advisor natin, usually, ang i-advise niyan is, kailangan within 18 to 65 years old lang yung population na kukunin mo para mas mabilis lang yung ethics board approval, di ba? Kasi mas matagal yan ma-approve kapag vulnerable subjects ang pinag-aaralan mo. Okay, so, sino yung mga prone to coercion? Children, pregnant women, elderly, prisoners with mental disabilities affecting decision-making. Pwede din yung mga naka-admit sa rehab center, mga treatment centers. Okay. Number 15, in a research study entitled The Effect of Listening to Music While Studying on the Memory of Junior High School Students, which is considered as the independent variable. Ito sa board exam every year, at least mga 3 questions, ito ang tinatanong, independent and dependent variable. So maganda na kailangan, kaya nyo na siyang i-distinguish mismo kasi sayang yung 3 points mo. So ano sagot natin dito? Independent variable is, yes, listening to music. Kasi ang independent variable is the presumed cause, while the dependent variable is the effect. So maganda na aralin nyo siya kasi sayang yung points nyo, 3 points din yan agad. Again, independent variable is the cause, while the dependent variable is the effect. Okay, so for situation number 4, ayan. For situation number 4, may nagbabalik. Yes. Siyempre si Sir Ray.
Thank you, Miss Michelle. So proud of Michelle. Be one of our junior lecturers after you pass the board. Join our team and get the chance to travel the world with Gapuz mentors. Ayan. So, dito na tayo sa situation number 4. I know, kumukulo-kulo na ang ating mga intestinal organisms, but you know, okay, this is how we're going to do our virtual online class every now and then. So, bago ko lang makalimutan, at mamaya uulitin ko uli, this is gonna be our virtual class series. Okay, so after today, we're gonna upload, the video version, and then we're gonna give you the link. We're gonna send it to you. So kung gusto mong balikan ni uli ito, that's okay. Okay, and then we'll have another webinar or virtual lecture series on July 11th, 19th, and 26th. That's just for the month of July. We're going to give the schedules again once we're done with July. And then we're going to do August, more likely twice or thrice a week na yun. So, kailangan sanayin muna natin mga sarili natin, di ba? Masarap yung slowly muna sa umpisa, tapos ilang push tayo sa gitna. Okay, so we'd like everybody to get accustomed to, you know, sitting in front of the computer, talking to your screen, listening to us. We'll get through it. Okay? I know how you feel. Hindi lang po tayo ang ganyan. Kahit sa Amerika, nung ako'y nag-aaral doon, lahat ng mga estudyante gusto pa rin talaga face-to-face. At hindi talaga sila mapilit na mag-online. Pero because of the pandemic, we have no choice. Okay? So once again, yes, yung mga nag-a-ask sa chat box kung free daw ba yung sessions ng July 11 and yes, we are doing that for free pa rin. And somebody just asked kung ang kanyang friend daw ba ay pwedeng sumama. Sige, okay, pati mami mo, daddy mo, lolo, lola. Pero yung mga manok, okay, itinola daw nyo muna. Tapos yung mga bata, padidehin muna bago tayo mag-start. Okay? So let's begin with situation number 4, colleagues. After surgery, proper care and dietary modifications must be implemented by the nurse. The following questions relate to post-op patients and their diet. Wow! Pinagsama ang intraoperative and post-operative nursing care together with dietary modification. Now take note, class. Concepts related to therapeutic diets is always a cornerstone of management, okay, in the care of clients with various conditions. That's why, expectedly, meron at meron yan sa ating konsepto. Okay? So expectedly, meron at meron yan. Okay? So let's move on. So this is number 16. Which of the following complications of suctioning should the nurse prevent through the administration of oxygen prior to the procedure? Okay, let's apply our test-taking skills and strategies. Okay, now remember that before and after suctioning, okay, we usually administer 100% oxygen to the patient. And that is primarily, alin ba dito, among the options, ang related to the oxygenation status of the patient. It's actually hypoxia. So that's the answer. So the administration of 100% oxygen before and after suctioning is actually directed towards preventing hypoxia. And we also take note that suctioning should be limited within 10 to 15 seconds, and it's applied intermittently as the suction is withdrawn. Okay? Okay. So the answer is number 1. Okay, here's a functional concept. Hyperoxygenating the patient with 100% oxygen before and after suctioning prevents hypoxia. Okay, now let's move on to question number 17. This is a select all that apply question or multiple choice with multiple response. My goodness. Okay, look at this, class. Which of the following statements about tracheostomy suctioning are true? Okay, so before we answer, okay, this question, we need to recall several concepts. Okay, if you would notice, you have 6 statements here, like suctioning may cause hypoxia if done beyond 10 seconds, pressure setting for the tracheostomy suctioning should be 80 to 120 millimeters mercury, the suction tube length that is inserted should be 5 to 6 inches, suction is applied upon insertion of the tube, suctioning is done based on the patient's condition, deflate the cup of the tracheostomy before suctioning. All of these statements requires us to recall concepts, okay? So initially, let's do that. Let me just approve some of your friends who are still coming in. Okay, I do perfectly understand. Some of those who are registered were complaining a while back na nawalan sila ng kuryente dun sa kanila. So, yeah, that's the reality we have to face. That's why we're uploading this. Don't worry, colleagues. We're uploading the video version of this after we edit it. Okay, para within the week ma-upload namin. We'll give you the link. Okay, okay. So let's recall the concepts now. Okay, let's begin with a functional concept. Here's some helpful hints for tracheostomy care. First, the cuff pressure should be below 25 millimeters mercury. Okay, now what's the purpose of the cuff? To keep the tracheostomy in place. But if the cuff pressure, okay, is more than 25 millimeters mercury, it could actually exert too much pressure on the mucosal lining of the area that could actually lead to ulceration. So you have to keep the cuff pressure always below 25 millimeters mercury. Now, pressure setting for tracheostomy suctioning, this is for suctioning, should be at 80 to 120 millimeters mercury. That's just enough suction. Okay, and then suction catheters can be used for 24 hours, especially if the patient is in the home setting. Tie changes require 2 competent persons. So when you're changing tracheostomy ties, you make sure that you first insert the new ties and secure it before removing the old ones. Because if you inadvertently remove the old ties and you have yet to insert the new ties to secure the tracheostomy, what if the patient suddenly coughs? E di na-dislodge yung tracheostomy mo. And if that happens, well, the patient could have difficulty in breathing. Okay, so it's very, very important that you have to do the tie changes with two competent persons. Okay, then tube changes should be done before meals or at least an hour after meals to minimize aspiration. Okay, so we go back now to the question that we have a while back. So which of the following statements about tracheostomy suctioning are true? Suctioning may cause hypoxia if done beyond 10 seconds? Yes. Okay, so we put a check. Pressure setting for tracheostomy suctioning should be 80 to 120 millimeters mercury. We recalled that a while back, so it's a yes. The suction tube length that is inserted should be 5 to 6 inches or until you reach the bifurcation of the bronchial teeth, the saccharina. So approximately 5 to 6 inches is appropriate. Yes. Okay. Suction is applied upon insertion of the tube. No, we apply the suction upon withdrawal of the tube. We do that intermittently. So this is an X. 5, suctioning is done based on patient's condition. Yes. Deflate. Ano ibig sabihin ng deflate? It's where we eat. Diba? We eat. We eat on deflate. Diba? Di joke lang, kayo naman. Alam ko gutom na tayong lahat. Pero lahat tayo, syempre kailangan matuto. And ito yung pinaka-ambag na namin sa inyo na habang nasa pandemya tayo, makatulong kami sa lahat ng pwede naming tulungan. Kung pwede nga lang namin tulungan yung walang internet access, bakit hindi? Diba? For as of now, dun tayo sa may internet access. So, deflate the cuff of the tracheostomy before suctioning. That is not done. That could actually potentially lead to dislodge because the cuff is aimed at anchoring the tracheostomy tube in its proper place. Okay? So, here are other helpful hints for tracheostomy suctioning. Remember to always hyperoxygenate the patient with 100% oxygen before and after suctioning. Then the suction catheter is advanced for a maximum of, take note, 6 inches or approximately 10 to 15 centimeters or until resistance is felt or until the carina is reached. Okay? Carina is a bifurcation of your bronchial tubes. Okay? Apply suction for a maximum of 10 seconds as catheter is being withdrawn from the tracheostomy. Some literatures would say 10 to 15 seconds. So within the time frame, that's just perfectly fine. But for optimum prevention of hypoxia, then you should actually do it for a maximum of 10 seconds. Okay? And take note, while the catheter is being withdrawn. And then take note, it's distilled water that is used when you are doing the suctioning. And in between suctioning, allow the patient to rest for 20 to 30 seconds. Okay? That is to allow the patient to breathe in and breathe out. Okay? Okay, now, question number 17. Which of the following are early complications of tracheostomy tube insertion? Okay, now, pay particular attention to this word, early. Okay, so let's identify. So, usually, after the administration or creation of a tracheotomy, where the tracheostomy tube is inserted, dislodge is not a worry, but bleeding is. Now, what about aphonia? Aphonia, ano ibig sabihin yan? The grandchildren. Aphonia. Sorry gutom na talaga tayo. Kung anong definition ang lumalabas. Okay, aphonia means loss of your ability to talk, your loss of voice. That's aphonia, okay? It's usually due to the damage to the recurrent laryngeal nerve, and that could be a possibility during the creation of your tracheotomy wound. Okay, bacterial infection is not an early complication. It is actually a late complication. Subcutaneous emphysema is the accumulation of oxygen or air underneath the skin or the subcutaneous tissues. Yes, this is an early complication. Now, when you palpate, there's usually crackling, okay, on the area where there's subcutaneous emphysema. So how do you assess for subcutaneous emphysema? If you'll be asked in the exam, you assess subcutaneous emphysema by palpation, okay? And granuloma formation at the tracheal wall, again, this is a late complication. Okay, now to distinguish which ones are late and which ones are early, you have dislodge, bacterial infection, and granuloma formation. These are late complications. The early complications are bleeding, aphonia, and subcutaneous emphysema. Now, para hindi po kayo malito, Okay? Hindi nyo na kailangan to sulatin. You have to write this down. It's in the PDF file that we're sending you for free after our session today. Okay? Huwag po kayong mag-alala. Ang hangad po namin, kayo po ay makapasa. So, wala po kami ipinagdadamot dito. Bibigyan namin yan. Kaya ayaw namin madistract kayo ng kasusulat. Okay? So, alam namin, hobby nyo yun, di ba? Hindi kayo nakakatulog, binabangungot kayo pag di kayo nagsusulat. Pero, okay, at this point in time, mas maganda yung papadala ko PDF file, o ganito rin yung itsura, o, di ba? Mas madaling tandaan. Download mo na sa cellphone mo. Okay? So, early complications of tracheostomy procedure include, okay, we have a code, BAD, okay? You have bleeding or blockage. Then you have air trap around the lungs or pneumothorax or around the skin, subcutaneous emphysema, and damage to the esophagus and the recurrent laryngeal nerve. And this damage could actually potentially lead to aphonia. Okay? Okay. On the other hand, the late complications of tracheostomy procedure include aid. O, di ba? Bad aid. Bad pag early, aid pag late. Okay? Accidental removal of the tracheostomy tube. Now, which brings me to a question on prioritizing. Example, if you'll be asked on the test, what is the highest priority when you're taking care of a patient with tracheostomy? Is it maintaining sterility, okay, of the tracheostomy, or is it keeping an extra tracheostomy set at the bedside? Now take note, to be able to answer that, you have to go back to the primary purpose of your tracheostomy, and it's primarily intended to facilitate breathing, okay? And therefore, sabi nga natin, di ba, priority, airway. Okay? So, how do you facilitate breathing of the patient? You have to keep the tracheostomy patent. Okay? Now, if there's accidental removal, there's a possibility that, okay, the wound would potentially close and the patient will go into respiratory distress. So, between preventing infection by maintaining sterility and, okay, ensuring the tracheostomy is open or facilitating breathing through the tracheostomy tube, you have to go back to your goal of care. The goal of care is to ensure that the patient is breathing. Therefore, which is the higher priority, maintaining sterility or keeping a tracheostomy set at the bedside of the patient? Keeping the tracheostomy set at the bedside is of higher priority, because if dislodge occurs, you have to have another set, okay, to insert immediately if there's accidental removal of the tracheostomy tube. Don't forget that concept. Maraming nalilito doon. Okay? So priority, okay, ensuring that you have a patent airway for your patient. Okay? Next, infection is a late complication. Okay, once again, look, accidental removal of the tracheotomy is mentioned well ahead of infection. So that should give you an idea that keeping the tracheostomy patent should be your priority. And last but not the least, damage to the trachea. Okay, question number 19. Which of the assessment findings in a patient who had colostomy 48 hours ago indicates a complication? Nako, ito na. After ng tracheostomy, ito naman si colostomy. Okay, so let's go through each of the options. Now, first and foremost, your colostomy could be temporary or it could be permanent. It's usually done, okay, to ensure that there's going to be appropriate excretion of fecal matter, especially when there is a condition that interferes with normal bowel movement. Okay? So, when your colostomy is created, what are the things that you will expect to see on your patient? Okay? Definitely, meron silang tinatawag na, okay, body image disturbance. Okay, so how would you know na nawala na yung body image disturbance nila? When the patient is already comfortable looking at the colostomy stoma. And that's the time that you can begin teaching the patient about how a normal colostomy stoma should look like. Okay, so first we begin with the color. It should be pinkish or reddish, and it's usually 1 to 2 cm above the skin level. So normally, you could see it as inflamed. It's usually moist. Okay, now, if the stoma becomes pale and then eventually bluish, that's a cause for alarm. So there could be impaired circulation. Okay. Now, after the creation of the colostomy, usually it would take 48 to 72 hours before your bowel motility returns. Okay? So therefore, normal lang naman na wala siyang discharge for the first 48 to 72 hours. So after 72 hours, then we expect discharge to appear. And the characteristics of the discharge would depend on the location of the colostomy. Okay, if it is on the right side, so it's the ascending colon that is affected, so that's liquid. If it is on the middle of the abdomen, so it's transverse colostomy, so it's usually semi-solid. Now, if it is on the left side, so it's a descending part of the colon that's affected, so it's usually formed. Okay, now one important thing is that you have to remind your patients to always discard the or empty the colostomy bag or the appliance, okay, once it is 1/3 to 1/2 full. Don't wait for it to be more than that, okay? Now, there's a question. Can patients with colostomy get pregnant? Of course, okay? Hindi naman sila doon sa stoma nagsisex, di ba? Okay. So, can a patient with colostomy swim? Of course. Okay. They can still swim. Walang problema yon. Okay. Don't forget about that. Now, spots of blood around the stoma. If it's just the word spotting, ibig sabihin small amount. Now, remember that a newly created stoma, sensitive pa yung mucosal linings yan. So, any pressure that is applied could really lead to minimal bleeding, like described as spots of blood. So, that is to a certain extent, di ba, expected. Now, take a look at number 4. Cramps lasting more than 2 hours. This is something that you need to refer immediately to the physician because this could potentially tell you that there is a complication that the patient is developing. Okay? So, which assessment finding in a patient who had colostomy 48 hours ago indicates a complication? That's cramps lasting more than 2 hours. Okay, now here's a functional concept. Symptoms that are not a cause for alarm, keyword, not a cause for alarm in a patient with colostomy includes spots of blood on the stomach, which may be due to irritation of the skin, flatulence, okay, odor which can be controlled with diet and routine cleaning. So pag nangangamoy, that's expected. If it is controlled by diet or routine cleaning, no need to worry. Pinkish and inflamed stomach, that's expected. Absence of discharge, 72 hours after surgery, to a certain extent that is expected. Now, phantom rectum, okay, parang phantom limb pain lang yan. Urge to defecate, even with the creation of the stoma, alam na nila na wala na silang itatae, nararamdaman pa rin nila na natatai sila. Okay, that's called phantom rectum. Okay? Parang may nararamdaman kang gusto mong tumae, pero wala ka namang itatae. O, wag mo sabihin meron kang ganyan ngayon. Ang tawag dyan, tenesmus. Okay? Pag natatay ka at akala mo, uutot ka lang, biglang may tae na, ang tawag doon, dugyot. Okay. Okay. Okay, di ba? Sa Ilocano, dugyot. Okay, nila na dulpot. Di ba ganon? Okay, now. Okay. So, wag naman ganon, di ba? So, expectedly, may phantom rectum or urge to defecate. And you have to explain to the patient, that's because your central nervous system is still sending signals, okay, to your GIT. And that is expected. Di naman agad-agad nare-reprogram yon, okay? Now, symptoms in a patient with colostomy that requires notifying the doctor. So, ito na ngayon. Anong kailangan mo i-report sa doctor? Cramps lasting more than 2 to 3 hours, especially if the cramps comes with foul-smelling odor that cannot be controlled by diet or routine cleaning. Then there's something wrong. It could be that may nabubulok sa loob, okay? Then you have continuous nausea and vomiting, severe watery discharge for more than 5 to 6 hours. This could actually be seepage that could actually be masquerading just as a blockage of the stomach. Okay? And then bad odor for more than a week, which could indicate infection, and continuous bleeding in between the stomach and the skin, and an injury or cut in the stomach. Okay? So take note, continuous bleeding. The key word here is continuous. Okay? If it's just spotting, no need to worry. Okay? Now, question number 20. Which of the following food will not cause flatulence in a patient with colostomy? The key word is not. So which one will not cause flatulence? Okay. Fish and chips with onion rings. Parang alam nyo na to ha. Cheese sandwich. Okay. Then egg sandwich. Yogurt and bananas. Okay. Now, pag iniisip mo to, usually, okay, poultry products and your vegetables are gas-forming, okay? And could therefore cause flatulence. So, Your letter A, pay particular attention to your chips with onion rings. Letter B, cheese. Okay. Letter C, eggs. Now, chances are the correct answer would be 4, yogurt and bananas. Okay, yogurt is actually good for odor control in patients with colostomy. So therefore, if you want to avoid or to prevent flatulence in a patient with colostomy, all you have to do is to counsel the patient to avoid eating fish, chips, onions, cheese. Okay. So here's a functional concept. Foods that may produce gas and odor in a patient with colostomy includes cabbage, cheese, eggs, onions, fish, and milk. So you have CEOFM. Cabbage, cheese, eggs, onions, fish, and milk. Ngayon, kung makalimutan mo yan, basta tandaan mo, most vegetables are gas-forming, including your poultry products, cheese, egg, and meat. Okay? So para hindi mo na makalimutan. Okay? So usually, it's not beneficial for the patient with colostomy to have this in their diet. Okay. Now, let's move on to situation number 5. Ay, nakakatuwa itong situation number 5. Okay? Our genes determine the physiologic destiny of our body. Okay. The next set of questions pertain to a genetically transmitted condition. Okay. Question now. Sometimes, ano ba ang silbi ng situation? Patulad ng situation na to, napaka-general, di ba? But there's one word there that should always give you a clue and should always direct your answer. The word genes. Okay? Ayan. Accept muna natin yung mga nagre-re-enter. I feel for you guys. I know how difficult it is pag bumabagsak yung internet signal. Okay? Okay. Enter lang kayo. I'll approve. Okay, so question number 21. Which of the following information, if described by a patient, can be considered as the most common initial manifestation of amyotrophic lateral sclerosis, or ALS? The first and foremost thing that you have to bear in mind, okay, for you to be able to answer this question correctly is, what is ALS? It's actually one of the motor neuron disorders, okay, that it's actually the most common among several, okay? Now, the next question that you have to ask yourself is, what causes ALS? In some cases, okay, it's considered idiopathic or unknown, okay? But there are cases in which it's genetically transmitted through autosomal dominant pattern, which simply means it could affect both males and females. Originally, in the past, akala nila this is just present in males. Kaya nga initially it's called Lou Gehrig's disease because an American athlete was the first to come out with symptoms associated with ALS. But then, after several researches, they found out that it could actually also affect females. Okay? Now, in some cases, okay, the disease affects a specific body part. So meron tayong tinatawag na bulbar onset, ALS. Bulbar, what is usually affected? The structure in the brain that is referred to as the bulb, meaning the medulla. So if you have bulbar onset ALS, it's usually the face, including the facial muscles, that's initially affected. But in 70% of cases, so most cases, are the limb onset ALS. So pag sinabi nating limb onset ALS, what are usually affected? Okay, so initially, the ones that are affected would be the extremities, the legs, and the arms, okay? Before the ability to speak, swallow, and breathe are affected. That's why if you'll be asked on the test, okay, initially, what is the appropriate nursing diagnosis? It would be impaired physical mobility. Kasi initially affected talaga, pag limb onset, ay arms and legs, okay? So, hindi dahil priority airway ang pipiliin mo, ineffective breathing pattern, no. Okay, breathing, okay, is affected after, okay, the weakness has affected the extremities. So, ang priority mo therefore would be impaired physical mobility initially. And then, as the disease progresses, it would eventually impair speech, swallowing, and then breathing. Okay? So, alin ang mauunang nursing diagnosis? Impaired physical mobility. Okay? In a late stage, ALS, then that's ineffective breathing pattern. Okay? If you ask me, which age group is usually affected? Now, this condition usually affects those between 50 and 60 years of age. What is sad about this condition is that there's no cure. Okay? There are medications that can either prolong the life of the patient for 2 to 3 years, ganun lang kaikli, and it's very expensive. That's your Riluzone. Okay, and there are also medications that could just slow the progress of the symptoms. Edaravone, okay, which is administered per IV on a daily basis. So you can just imagine, mawawala yung pera mo and yet, hindi ka pa rin mabubuhay. So you have an ethical dilemma eventually. What do you want, di ba? You will die a pauper or die with some amount leaving to your loved ones. It's your choice because it's your life. So kailangan nila dito, diba? Meron sila dapat ditong advance directive. Naka-specify anong gusto ng pasyente. Maggamot siya or wag na. Kasi pag hindi, well, bibigyan na lang siya ng no extraordinary means. Diba? Okay. Meron na siyang DNR order, do not resuscitate order. Ganun. Okay. So, since initially the condition would affect the extremities, so we expect muscle weakness. So actually meron niyang muscle weakness, muscle rigidity, muscle twitching. Lahat nandyan sa options. Okay? Ang pagpipilian mo ay kung ano ba, progressive ba siya or non-progressive. What did I tell you a while back? Kasi eventually it affects your speech, your swallowing, and your breathing. So definitely it's progressive. So you're narrowing down your options between 1 and 2. Kasi yan lang naman progressive. Now, ang usapin ay painful ba o painless? O, ayan na. So, it's painless progressive muscle weakness. Okay? So, that is actually a common manifestation initially. So, always remember the functional concept. The most common initial symptom of ALS is the presence of painless progressive muscle weakness. Okay? So, therefore, ang exception mo sa nursing diagnosis would be pain. There's no pain initially in ALS. Okay? Question number 22. Ay, malapit na. Okay. Which of the following are manifestations of amyotrophic lateral sclerosis? Okay, we're talking about manifestations. Okay. So, bleeding, meron ba? Wala. Remember, your ALS is a motor neuron disease. So, it affects the central nervous system. It affects the spinal cord and the brain. So, slurred speech, yes. Mood swings, now take note, this could go chronic. And any chronic condition could eventually lead to depression and recovery. So mood is expected. Okay, weight gain is usually not expected because it's weight loss that comes with depression. That's usually a comorbidity in patients with ALS. Dysphagia or difficulty swallowing, yes. And then painless muscle cramps, no. What you have would be muscle weakness, not muscle cramps. Okay? Now, remember the manifestations of ALS include ALS, abnormal fatigue of arms and legs, L, laughing, crying, and yawning inappropriately. Now, laughing and crying is the description of your mood swings. And then S, slurred speech and swallowing difficulty. Okay, question number 23. Which of the following functions, the key word is initially, okay, affected by amyotrophic lateral sclerosis? What did I tell you a while back? In your limb onset ALS, it's usually the arms and the legs that are initially affected. So, we talk about walking. Yan. Okay? So, initially in ALS, difficulty in walking occurs. As the disease progresses, breathing difficulties, speaking problems, eating problems, and frontotemporal dementia develop. Okay? So number 24, to determine the cause of amyotrophic lateral sclerosis, the nurse should refer a patient suspected of having the disease to AOK. Now, to whom would you refer the patient? We said a while back that ALS is genetically transmitted. So definitely we need to refer the patient specifically and the family members, the caregivers, to a geneticist. Bakit? They need to be oriented if they want to prevent the occurrence of the condition in their family. So what are their options? Okay? Okay. So, ang problema, lahat ng option may geneticist. And what did I tell you a while back? Okay? Your patient with ALS, okay, would usually have primarily affectation of the brain, okay? Central nervous system, the medulla, and then the spinal cord. So, therefore, you need, together with the geneticist, a consultation with a neurologist. Of course, an orthopedic specialist specializes in bone problems, nephrologist, kidney problems, psychiatrist on mental health conditions. So, the best answer is number 2. Ayan. Now, our last item. Kaya lang parang napapagod ako. Gusto ko magpa-break ng 1 hour joke. Joke lang, joke lang, joke lang. Baka patayin nyo ako pag hindi ko to tinuloy. Okay. So let's talk about the last question. Which of the following nursing diagnosis is the highest priority of the nurse when providing care to a patient with late-stage amyotrophic lateral sclerosis? The key phrase here would be late stage, okay? Late stage, okay? And you have another another set of keywords, highest priority nursing diagnosis. So what did I tell you a while back? After the affectation of the limbs, eventually the patient would have difficulty swallowing, difficulty chewing, and then breathing difficulty. Okay? So the best answer is ineffective breathing pattern. You would ask me, why not ineffective airway clearance? Well, ineffective airway clearance, the main affectation here would be the airway. When the patient would have mucus, okay, secretions that accumulates in the airway, then this should be your nursing diagnosis. Now, impaired gas exchange, an alkalotic or acidotic stage manifested by your abnormal ABG results, then you have impaired gas exchange. But here, since in ALS, it's the muscles of breathing that are affected, so it's the breathing pattern that is ineffective or impaired. So the best answer is actually ineffective breathing pattern. So congratulations for those of you who finished answering the questions and listening to us. But look, we just finished the 3 strategies. Di ba sabi ko kanina, may extra strategy. Pero bago tayo pumunta sa extra strategy, paalala ko muna, we will be giving out copies of the nursing reminder sheet to our lucky participants. Okay? Paano ang gagawin? To avail of the copy, madali lang. Okay? I'm sure nagsagot kayo ng questions. So, nagsagot kayo ng questions, bilangin nyo yung correct answers nyo. Okay? We trust you. We value honesty. We still believe that there's the good in all human beings. Nandito pa rin ngayon time ng pandemya. So, di natin kailangang mandaya. Okay? So, ang gagawin mo, screenshot mo yung score mo doon sa papel na sinulatan mo, send it to our email address, and then yung first 5 na magsisend ng highest score. So dapat, dalawa yung criteria doon ha, isa ka doon sa first na 5. At doon sa first na yon, isa ka doon sa may 5 pinakamatataas na score. Kumbaga, nakakuha ka nga ng 24 out of 25, pang-6 ka na nag-submit, di wala din. So, kailangan, first 5 makapasok ka at dun sa first 5 na yon, mataas yung score mo. Pwede naman pang 15 ka, pero yung score mo nasa top 5, pasok ka pa rin. Okay? So, that's the mechanics. Okay. Now, sabi ko sa inyo kanina, if you continue to listen, kailangan malaman mo ano yung pang-4 na strategy. The first 3 strategies we talk about, colleagues, are all about content. Diba? Knowing what to expect, how to pass the exam, practicing how to answer questions. Okay? Nagawa natin. But more than the content, sometimes we need a psychological push. And that psychological push is contained in this message I'm going to share with you. It's called the extra strategy. Galing ito kay Jules. Sabi niya, some say in passing the board exam, you need 2 main ingredients. 99% of studying and 1% of inspiration. In RA Gapuz Review Center, I got 99% of good study guidance, okay, from all the very well-rounded and respected coaches, modules that are well-patterned to the exam, a friendly and well-organized and reliable staff. And that main ingredient, my 1%, that stranger who sits in front of me every single day of my review class and is now my girl, di ba, nahanap siya na forever. And with those 2 ingredients, I passed the NLE. Thanks to RA Gapuz for giving me not just 2 of what I needed in passing, but also gave me my forever in life, in love, and in my career. What more could you ask for in a review center? Ragarsi gave them all to me. Thank you so much, Ragarsi. Sincerely yours, Jules Bukiren RN. Of course, Jules, ang mapapayo ko lang sa'yo ay salamat sa pagpapayo mo sa kanila na huwag makakalimot sa isang bagay na importante sa preparation sa board exam. Ano yun? Inspiration. So, kailangan nyong may inspirasyon para kayo maganda at holistic ang preparasyon. Okay? And what's next after natin nito? Sabi ko nga, ulitin ko yung announcement. July 11, 19, and 26, we'll have our next set. And please do suggest ang topics na gusto nyo. Is it psych? Is it MS? Is it Funda? We're gonna address that. Free pa rin ang materials. We will have more materials in the next webinar that we're going to do. Okay? Free pa rin yun. You can download it for free. And take note. Okay, sabi nito, thank you sa trust. Sabi naman ni Jay, we know sir, pasado kami dahil sa review center nyo. See you sa NCLEX. That's the next step. Thank you. Di ako nagkamali mag-enroll sa inyo, pero dahil since nag-aral ako, RAG-RC na narinig ko, kaya pinili ko kayo. Walang nasayang na sense yung wagi. Yan. Salamat sa tiwala. So, what's your next target? Target the NCLEX. Kasi kailangan tayo ngayon talaga ng mundo. And for preparing for the NCLEX, I am proud that I am the first and only Filipino to have written, okay, a nursing review book for Mosby, Elsevier, and Jones and Bartlett, USA. Ito, masaya na ako. No? Nakita mo, Lippincott, Saunders. Achievement po yan ng Filipino, and I'd like to share that with you guys, okay? And we're also providing NCLEX scholarship. So, let's learn together. For more instructional videos, subscribe to our YouTube channel, Gapuz Mentors, and my Facebook page, Mentor. Thank you for listening. Clap na po tayo. Maraming salamat. And I'll join you again on July 11, July 19, and July 20. Have a nice one. Please send us a message dun sa comments. Sa ng comments. Yung mga chats nila. Go. Ayan. Ayan. Thanks po. Ano po yung dates ulit? July 11, 19, and 26. Pero bago yan, magkakaroon pa tayo. Thank you so much, Sir Ray. Thank you.